Hello everyone, very good evening to all of you. Sorry for being late, there was some technical glitch. Am I clearly visible, audible? Kindly confirm in the chat box if I'm clearly visible, audible, everything is good to go. I will start with the most awaited topic and the demo of ENT today. Okay, so I'm waiting for your comments. If everything is good to go, I will start the class. Very good evening to all of you. I welcome you all for today's session. Yes. Is everything is good to go? Thank you. Thank you so much for confirmation. Thank you so much for confirmation. So I welcome you all for today's session. Very good evening to all of you. Today is our first demo class of ENT. And today I'm going to take a ultra important topic in ENT, that is assessment of hearing. Today I'm going to teach you with the 3D models and I will do the live test in front of you so that you can understand this topic better. But before coming on this topic, as many students are new students over here, I would like to orient you a little bit about this batch. That is third Prof Buster 1.0, this course, this batch. Okay, so most of the students are saying or asking that, ma'am, why this batch is so special, so important. So let me tell you the reason behind that. In this batch, I'm going to teach you these 4 subjects: ENT, ophthalmology, PSM and forensic medicine. Now many students are saying that in third Prof we are having only 2 subjects, that is PSM, community medicine, and forensic medicine. ENT and ophthalmology is not there in the third Prof. It is shifted in the fourth Prof. Okay, in many universities, but in some universities it is included in third Prof itself. So my advice for all of you, whether it is in third Prof or final Prof, you should finish it in the third Prof itself, because in the final Prof you already have a bulk of 9 to 10 subjects and you have less time in the final year. So it's better to complete these 4 subjects along with MedLife in just a span of 4 months. In just 4 months, 10 days, I will complete these 4 subjects cover to cover, each and every topic, whether major topic, whether minor topic. All these 4 subjects will be covered. One more thing, many students have doubt that this batch is regarding university exam or the competitive exam. I mean, it is MCQ based or is it long question, short question, university theme based? So it is both ways. It's a complete coverage of these 4 subjects according to the university exam itself, as well as based on these concepts. You try any MCQ, any PYQ of any platform, take my challenge. You will be able to solve all the MCQs. So take my words, these 4 subjects will be covered for university exams as well as for competitive exam. Here in this batch, I will be teaching daily 2 to 3 hours live class in the evening itself. It's 2:1, 2-day class, 1-day break, 2-day class, 1-day break. That model we have selected so that students are not exhausted. You people are not exhausted for continuous classes. Okay, duration will be 4 months. It is already started on 11th October and it will be ended on 22nd of February. So this is the exact schedule in front of you. You can see the color coding and exactly it is ending on the 22nd of February, 4 months, 10 days. Here along with the live session, you will get 3 type of notes: digital notes, printable notes and annotated notes. Whatever I am teaching you, slide to slide, I will provide you the PDF. You can take the printout at your comfort and you can read, you can revise from that. Okay, and I'm providing you 3 type of question bank. University exam question bank, which is topic by topic, containing long question, short question, very short question of that particular topic. So after every session, you should have a look on that if you're preparing for your university exam, whether you're prepared with these all answers or not. And there is a NEET PG INI-CT PYQ question bank as well as PYQ question bank. Okay, so I will be teaching you with 3D models in this batch. Today, you will realize the importance of 3D model. Wait for just next 5 minutes. I will show you the anatomy of the ear with the help of 3D models, one by one. So we will study the ophthalmology as well as anatomy, as well as ENT, both the clinical subjects with these 3D models. Okay, total there will be 87 live sessions. Today is the 4th session out of the 87 in which we are going to cover the entire syllabus. So today we are having not 4th, I'm sorry, we are having the 5th session today. 4 are already done. Today we are having the 5th demo session, right? So in case of any other query, you can WhatsApp on this number. Now coming on the topic. Let's start the topic, assessment of hearing. Can I start? Everyone give me a thumbs up. Ready? So with this orientation, let's start the topic for today. Assessment of hearing. Here I will be telling you all the tests, clinical test, audiometric test, tuning fork test, whatever test required for assessment of hearing. Okay, but you cannot understand this topic directly, right? Just a second. You cannot understand this topic directly. Before understanding this topic, you have to understand little bit regarding the anatomy of the ear as well as physiology of the ear, so that you will have a better understanding of all these tests. I will teach you all these tests under 3 headings: the principle, the method or procedure, and interpretation along with the diagram. So all the tests we will compile in the form of the master chart in the end. It will be a super hit session. Okay, but before that, we have to look, we have to look a little bit at the anatomy and the physiology. Okay, so I think you don't mind if I first teach you the anatomy of the ear for the 15-20 minutes, then we will see the physiology of the ear, and then we will come on the test. Can I start the anatomy? So let's start the anatomy of the ear. We all know we divide the ear into 3 portions. What are the 3 portions we divide the ear? External ear, middle ear, and internal ear. You can see we are dividing the ear into 3 portions: external ear, middle ear, and internal ear. The 3 portions of the ear. You can see these are the 3 portions over here. Okay, you can see from here till here, it's external ear. I will tell you the parts. From here till here, this is the middle ear, and from here onwards till end, it is the internal ear. Okay, so what are the structures in the external ear, in the middle ear, in the internal ear? We have to see a little bit. By the way, I'm not teaching you this topic in detail. I will take a separate session on anatomy and physiology. Our next session, I guess, after this demos, we will start the anatomy with the we will start ENT with anatomy and physiology only. But that will be a detailed session. Currently, I'm giving you anatomy and physiology of hearing, just a orientation. It will be superficial, so that you can have an understanding of the test, the various hearing tests, assessment of hearing. So that's why I'm giving you a brief overview of the anatomy. It's not a detail. There will be a separate session of anatomy and physiology of ear. Okay. So in the anatomy, we divide the ear into 3 portions: external ear, middle ear, and internal ear. You can see the 3 portions over here. Now, external ear is again divided into 3 portions. You can see the 3 portions of the external ear. It's pinna. Can you see my pinna? This is my pinna. This is my pinna. I will show you in the model also. This is pinna or auricle. Okay. Then external auditory canal or external acoustic canal, whatever you say. External auditory canal or acoustic canal. I will show you. It is EAC and tympanic membrane. These 3 portions are in the external ear. Can you mark it over here? Where is pinna? This portion is known as pinna. Appreciate this portion. It's visible outside. It is cartilaginous. Okay. This is pinna. This is external auditory canal. EAC, external auditory canal or external acoustic canal, EAC. And this is known as tympanic membrane. This is tympanic. So this is external ear. The 3 portions of external ear. Can you say with me? Pinna, EAC, and tympanic membrane. Middle ear. Middle ear have only 2 things. What 2 things? The 3 ossicles: Malleus, Incus, and Stapes. You know the 3 ossicles. The mnemonic is MIS, M-I-S. Malleus, Incus, and Stapes. And eustachian tube. You can see it here. Can you see the 3 ossicles over here? I will show you all 3 one by one in the models. And you can see this is the eustachian tube. This is the eustachian tube. Okay. So you have seen these 2 portions, and inner ear have again 2 portions. It is labyrinth. The bony labyrinth and the membranous labyrinth. You can see this complete portion containing the cochlea, containing the vestibule, containing the 3 semicircular canals. This is completely known as labyrinth. Externally, it's bony labyrinth, inside which there is membranous labyrinth. Okay, so these are the structures of the ear. You want to see it? You want to see it? Let me show you a model. Give me a minute. So let me show you a model. Okay. So I will show you all these structures in this live model. Can you see this live model? I will open it in front of you. First of all, in this live model, you can appreciate. I guess everyone can see. Give me a thumbs up. You can see this model. This is the giant model of the ear. I will open all the structures, each and every small structure in front of you, so that you have a better understanding. Okay. Can you see this, everyone? Yes? Okay. So you can see this is pinna. Appreciate. This is pinna. Let's start with external ear. What are 3 portions of the external ear? There is pinna. This is cartilaginous pinna. Can you see? This is cartilaginous pinna. Okay. After that, the second portion, I have to open it. You can see this bone. I'm opening this bone. Okay, let's open this bone. Let's keep it here. Okay, I have opened this bone. Now you can see this is EAC. What is this? This is your EAC. Okay, external auditory canal. This one. So pinna. Then there is external auditory canal, and there is tympanic membrane. You can see this is tympanic membrane. Can you appreciate the tympanic membrane? This is tympanic membrane. Let me open it from upside also. I'm opening it so that you can have a better view. So let me show you here. It's like this. I will show you all the parts. Okay. So this is the tympanic membrane. It is like an umbrella shape. You can appreciate the umbrella shape. Okay. Let's keep it here again. So external ear, the three portion. Can you state? Say, ma'am, first of all, pinna. Okay. What does pinna do? It collects the sound. It collects the down sound from the environment. Then we have external auditory canal, which transmit the sound or which connect the pinna with the tympanic membrane. This is tympanic membrane. Okay, it is connecting. And this is tympanic membrane, which is having two portions, pars flaccida, and I will show you the two portions over here. Okay, so these are the three portions of the external ear. Coming on middle ear. Middle ear is having three ossicles. So you can see the three ossicles over here. Let me show you. Just behind the tympanic membrane, appreciate the ossicles. Malleus, Incus, and Stapes is over here. So these are the three ossicles over here. You can appreciate the three ossicles. And after that, inner ear have the labyrinth. So this is the labyrinth. So bony labyrinth, inside which we have membranous labyrinth. You can see the three semicircular canals. You can appreciate the cochlea. You can appreciate the vestibule. And this is auditory now. So I will show you all these parts again as and when required. So this is the structure of the ear. So basically you have understood the three portions of the ear. External ear, middle ear, and internal ear. I guess you all got it? Yes or no? So can we continue? So I will show you multiple models to explain all these things. Okay, so we have understood the various portions, the three parts of the ear till now. Okay, one by one we will take it. Let's start with external ear. A little bit detailed. Only 10-15 minutes I will finish this portion so that you have a better understanding of the test. Okay, you enjoyed it? You learned it better? Give me a thumbs up, everyone. Come on. Give me some expressions. Can we continue? Yes. So you can see, let's start with the three portions of the ear one by one. Let's start with external ear. In the external ear, there are three portions. One by one we will take it. Let's start with auricle. Let's start with auricle. You already have a vision. What is auricle? This is auricle. So tell me the important points regarding auricle. It is made up of cartilage. Which cartilage? Elastic cartilage. You know the various types of cartilage? Yes or no in histology? Yes or no? So it is made up of elastic cartilage. The most important thing, it's a single cartilage. The complete pinna, you can move it like this. You can roll it like this. The complete pinna is made up of single yellow elastic cartilage. It's an MCQ. It's an MCQ. You can see this is pinna. This is pinna. Okay. Now see your own pinna and see. This is, you can see the lateral portion of the pinna and this is the medial portion of the pinna. And you see the skin over this portion. You see the skin over this portion. You try to do like this. You try to do like this. Are you looking at me? You try to and see which skin is loose and which is adherent. You decide yourself rather than learning over here. So skin present on the lateral surface is very adherent. Can you see the skin present on the lateral surface? It's very tight, it's very adherent. But skin present on the medial surface is loose. You can appreciate the skin present on the medial surface is loose. So no need to learn. Do your pinna like this. You will realize this thing. Okay, so pinna is made up of what? Single yellow elastic cartilage. It is having lateral surface. It is having medial surface. The skin on the lateral surface is adherent, tight. The skin on the medial surface is loose. Everyone got it? Okay. So this is regarding pinna. Now coming on external auditory canal. This is also pinna. The various portions, the various parts of the pinna I will teach you in the next session when I will give you detailed anatomy. Now currently I am coming on EAC. What is EAC? External auditory canal. So what is external auditory canal? This structure is external auditory canal. Okay, today I will show you many animations along with 3D models. You can't even imagine. So you completely have the 3D orientation of the clinical subjects. Be assured. You can see this is external auditory canal. It is connecting what and what? It is connecting pinna with the tympanic membrane. It is connection between the pinna and the tympanic membrane. Can you see? It is connecting pinna to the tympanic membrane. What is its length? It is 24 millimeter long. Totally it's 24 millimeter long. We divide into two parts. Outer part, inner part. You can see this is outer part. Outer towards the pinna it's outer. And inside this one towards the tympanic membrane it's inner. So this portion is outer, this portion is inner. They have different curvature. Outer portion is upward but inner is downward. I don't have a wire, I forgot to take it. Outer portion is upward, the inner is little bit downward. Okay, we talk about three axes. You know what are the three axes? I guess you may be knowing the three axes. Now, first you understood it's a connection between what and what? It's a connection between the pinna and the tympanic membrane. You can see it here. Okay, it is transmitting the sound from the pinna to the tympanic membrane. Appreciate the role of external auditory canal. What it is doing? It is transmitting the sound from the pinna to the tympanic membrane. It's a connection between the two. Now I'm talking about these three axes. We have x-axis, y-axis and z-axis. Okay, one by one we will divide them. I mean outer part and inner part of the external auditory canal. You can see this is outer part, this is inner part. Outer part, inner part. So around this axis, outer part is upward but inner part is downward. Outer part is upward, inner part is downward. Around this axis, outer part is backward but inner part is forward. Okay, and around this axis, this axis, okay, both the part are medial. Both of them are medial. So this is how with 3D orientation, I will show you in the model also the curvature. I will take it. So these are the curvatures of the external auditory canal. You can appreciate the little bit curvatures over here. Can you see the curvatures? Appreciate the outer part is little bit upward and inner part is little bit downward. You can appreciate it. Okay. And backward, forward, you cannot appreciate it because it's not a three-dimensional figure. But outer part is backward and inner part is forward. It's like that. And both of them are medial. Okay. So we have seen a little bit anatomy of the pinna, not complete. A little bit anatomy of external auditory canal. Okay. And now I'm coming on tympanic membrane. Let's start tympanic membrane. So external ear will be done. We are looking at the superficial anatomy so that we can understand the test better. Okay. Let's start tympanic membrane, also known as drum head. Tympanic membrane forms the partition between two things. Which two things? External auditory canal and middle ear. Can you see? This is tympanic membrane. This is tympanic membrane. Appreciate it. It is forming a partition between the external auditory canal and the middle ear. This is middle ear. This is external auditory canal. So it's forming a partition between external auditory canal and the middle ear. No need to learn. You have to understand everything. And it's oblique. It's not straight. You can't see it's straight. No, it's not straight. It's like this. It's oblique. So oblique means which portion is medial, which is lateral. So posterior superior portion is lateral. Posterior superior portion is lateral. Can you see? This portion is coming outside towards the pinna and this portion is going inside towards the middle. So this portion is lateral. Okay, this is posterior superior portion and anterior inferior portion is going medial. You learn one of them. You learn posterior superior portion is lateral. You can see it's towards the pinna. This is how it's oblique. It's oblique. I will show you in the model also. So it is having two parts. Pars tensa and pars flaccida. Most of the portion, it's like a umbrella. Let me take it out. Here. You can see this. It's like umbrella. Can you see? Can you appreciate? It's like an umbrella. So maximum portion, it is pars tensa. The periphery of the pars tensa. The periphery of the pars tensa. You can see the periphery of the pars tensa is known as annulus tympanicus. The periphery. Can you see the red margin? It is annulus tympanicus. Okay. And the portion which is above the handle of the Malleus. It is connected with the Malleus, M-I-S, Malleus Incus Stapes, in the middle ear. So this is Malleus, the bone Malleus, that is Ossicles. So behind the handle of the Malleus, this is handle of Malleus, there is a portion which is thin and this portion is pars flaccida. And the remaining all portion is pars tensa. The complete one is the pars tensa. This complete is pars tensa. Only this portion, can you see here? It is the handle of the Malleus which is attaching. Let me show you. Can you see it now on the black background? You can see it better. Okay, this is tympanic membrane I have taken from the model. It is umbrella shape. It is obliquely placed. I will place in the model and show you obliquely. Okay, you can see the complete tympanic membrane is known as pars tensa. Okay, only this portion which is ahead of the handle of the Malleus, behind which the handle of the Malleus is there, you can see. Okay, you can see it. Okay, so this portion is known as pars flaccida. Rest all is pars tensa. I will show you in the model. Don't worry, I will take it again. Okay, just a second. Yes. So we have seen that. Okay, the pars flaccida is known as Sharpnell's membrane. I will take anatomy again. That's why I'm very fast. Okay, because anatomy is not the main topic today. Today's main topic is assessment of hearing. Anatomy, I'm just telling you so that you have a better understanding. Today's topic is not anatomy of ear. Got it? So this is the tympanic membrane. Appreciate the complete tympanic membrane. This is pars tensa, only the portion which is above the handle of the Malleus, it is pars flaccidum. This is thin. This is thin, and this portion is thick. This portion is thick. I hope everyone got it. Okay, these are the portions of the tympanic membrane. Let me tell you a cross-sectional view. Can you see? This is the cross-sectional view. This is external auditory canal, and this is middle ear. This is middle ear. The partition between the two, the partition between the external auditory canal and the middle ear is tympanic membrane, which is obliquely placed. Here it is for the sake of understanding it straight, but it is oblique. Okay, you can see this portion, only this portion is pars flaccidum. The remaining complete is pars tensa. So pars tensa and pars flaccidum. You got with all orientation. With this, we are done with external ear. You want to revise with me? What are the three portions of external ear, people? What are the three portions of external ear? We are having pinna, which is also known as auricle. Here is my pinna. There is external auditory canal and there is tympanic membrane. We will see the external ear, the revision of the external ear quickly in the model. Okay. So let me show you quickly. Let me zoom it out. So let's revise it. Can you see it? Chalo. We are revising the external ear. So focus on the external ear. What are the three portions of external ear? You tell me the three portions of the external ear. There is pinna. Appreciate the pinna. Can you see? What are the important points regarding the pinna? It is single elastic yellow cartilage. Lateral skin is tight, but the medial skin is loose. You can feel your own. Got it? So pinna is done. Coming on external auditory canal. It's a connection between pinna and the middle ear. You can see it's a connection between the pinna and middle ear. This is external auditory canal. Okay. And it is 24 millimeter long. The length is 24 millimeter, and it is curved. The curvatures are not shown very good here. You can see there is outer part. This portion is known as outer towards the pinna, and this portion is known as inner part because it is towards the middle ear. You can see outer part, middle part. Now outer part, it is upward, and inner part is downward. Outer part is backward. You can see this one is little bit backward. This one is little bit forward, and both of them are medial. Both of them are medial, okay, towards the crane, towards the brain, like that. Okay, so this is external auditory canal. Now tympanic membrane. Can you appreciate this tympanic membrane over here? Appreciate it. Appreciate it. Appreciate it's like an umbrella. Appreciate it's not straight, it's oblique. So which portion is coming outside? The superior portion. You can appreciate this is superior. It is oblique. It's like this. It's like this. So the superior portion is lateral. Posterior superior portion is lateral. So appreciate the obliqueness. So this is oblique. This is tympanic membrane. It's a partition between external auditory canal and the middle ear. And it is having two portions, pars tensa, pars flacida. You know that. So we are done with external ear. Can I come on the middle ear? So this portion is middle ear. Can we continue? So let me finish middle ear, then I will show you here again. Okay. So let's continue with the middle ear. Okay. Let's continue. Chalo. So we will continue with the middle ear. We are done with external ear. Let's come on the middle ear. It's not coming. Okay. So middle ear, we are having two things. What are the two things? We are having ossicles and we are having eustachian tube. Everything is good going now. We are having ossicles and we are having eustachian tube. One by one we will take. So let's start with ossicles. Let's start. We have seen all these three structures in the external ear. Now in middle ear, let's start with the ossicles. What are the three ossicles? There are three ossicles. The three ossicles, the three bones inside the ear. What are the three ossicles? Name three ossicles. Huh? The three ossicles are Malleus, Incus, Stapes. M-I-S. In this sequence, from lateral to medial, bahar se andar ki taraf. From lateral towards inner side to medial. Okay. From lateral to medial, this is the sequence. M-I-S. Learn the sequence. Malleus, Incus, Stapes. Malleus, Incus, Stapes. Got it? So these are the three ossicles. Appreciate the three ossicles. Okay. So this is lateral. Pinna is always towards the lateral. Okay. And this is medial. So what is lateral side over here? Tell me. So this side is lateral. Yes. And this side is medial. Okay. Yes. So what is the sequence from lateral to medial? This is M. Appreciate M. I'm sorry. This one is not. This one. This one is Malleus. This is tympanic membrane. This one is Malleus. This one is Incus. And this one is Stapes. M-I-S. From lateral to medial. I will show you in the model also. Appreciate it. M-I-S. Got it? So these are the three ossicles. You see how they are vibrating, how they are transmitting the sound energy. Okay. From the external ear to the inner ear. They are transmitting the sound energy with an advantage, with a lever mechanism. I will explain everything. So these are the 3 ossicles you have. Now one by one we will take their details. Let's start with the first ossicle. What is the first ossicle? The first ossicle is Malleus. The shape of Malleus is like mallet. Why Malleus is known as Malleus? Malleus is known as Malleus because it is like a mallet. What do you mean by mallet? Mallet is a hammer, looking like a hammer. Appreciate this shape. It's looking like a hammer. More or less, it is looking like a hammer. You can see. Okay, and it is the most lateral bone among the 3. We have already seen here. So this one is the most lateral. This is Malleus. This is Incus. This is Stapes. So it is most lateral. So we already know about this Malleus. Okay, now what it comprises of? It comprises of 6 portions. You can appreciate all 6 portions over here. This is known as head of Malleus. Okay, this is head. This is anterior process. This is lateral process. This is neck. Okay, and this is manubrium. Appreciate the parts. So these are the parts. I will take it out. Okay. You can appreciate this is tympanic membrane. I guess you all can see just behind the tympanic membrane, the first bone is the Malleus. It's very small if you can appreciate it. If you can appreciate it, this is very small. Okay, this bone is Malleus, you can see. So in the Malleus, you can appreciate these parts. I wish I can give you in your hand and you can see all these parts. So it's looking the same structure like this, but it's very small in size. So these are the parts of the Malleus. I guess you got the parts of the Malleus. This is Malleus. Coming on the second bone, Incus. Incus is the largest among these 3. Miss is the largest one. Who is the largest among MIS? Incus is the largest. And Stapes is the smallest. S for Stapes, S for smallest. So Stapes is the smallest. Incus is the largest. Both of them are MCQs. And Malleus is the middle. M for Malleus, M for middle. Middle means middle in size, not middle in location. Location wise, this is most lateral. This is most medial. So this one is the largest among these 3. Incus. Okay, this is placed medial to the Malleus. The next to the Malleus is the Incus. Okay, this is the structure of the Incus. Okay, sometimes the labeling is asked in image-based question. Again, it is also having a head. Like the Malleus, it is also having a head, but it is having 2 processes. Long process, short process. This is long process, this is short process. You can see this one. Long process, short process. This is known as lenticular process. And this is the surface which articulate with the Malleus. This portion is the junction. You can't see the junction. There is a red line over here, which is the junction of the Malleus and Incus. It's very clearly visible over here. There is a red line. I don't think you are able to see this red line. There is a red line. So this one is Malleus, this one is Incus, and I can see the red line, the junction between them. I can see the parts over here. So Malleus is done, Incus is done. The third and the last ossicle, the bone, is the Stapes. Stapes is the shortest. Stapes is the shortest. Let's look like this. It is very easy to identify the Stapes because it is having a foot plate. This is known as foot plate. And it is having 2 crusts. Anterior crust, posterior crust, and head. Head is present in all these bones. Okay. It is having 2 crusts. Anterior crust, posterior crust. And there is a foot plate. And foot plate of the Stapes bind with the round window. It will bind with the round window. Okay, it will continue with the inner ear now. Stapes, M-I-S. S will continue with the inner ear. So it will bind with a round window and it will transmit the vibrations ahead. Okay, I will tell you the complete story. So this is the structure of the Stapes. You can see it is having a head, 2 crura. Okay, you can see anterior crust, posterior crust, and there is a foot plate. So with the help of foot plate, you can easily identify. Image-based questions are very common in ENT and Ossicles people. So please focus. Okay, so this is the structure. So I told you the structure of the 3 ossicles. M, I, S. Broadly you have to learn. Okay, you don't have to draw exact in your exam. Okay, but for MCQ purpose, you should know. So this is Malleus, this is Incus, this is Stapes. Okay, this one is the largest and this one is the smallest. Okay, this one is largest, this one is smallest, and from lateral to medial, this is the sequence. So you can see this is lateral towards the tympanic membrane and this is medial towards the inner ear. Okay, now this is the articular surface. I mean, Malleus bind with the tympanic membrane. I mean, it articulates with the tympanic membrane. So after Malleus, there is Incus. After Incus, there is Stapes. And the foot process of the Stapes, it articulates with the round window and communicates with the inner ear. So this is how the complete story is. Everyone got it? These are the 3 ossicles. Appreciate Malleus, appreciate Incus, appreciate Stapes. At least in image-based question, you are able to identify them. Okay, they are not going to ask you the exact parts, but at least you can identify from their shape which ossicle is it, which is the largest, which is the smallest, which is the most lateral, which is the most medial? Okay, which one is articulating with what? Okay, you should know the answer of all these things. Everyone give me a thumbs up. Everyone. So we are done with the ossicles. Say, people say. Can we go ahead? Okay. Am I live? I guess I am. Okay, so let's go ahead. Yes. So these are the three ossicles and their parts. See, one by one I will show you. I will show you in reverse order. First I will show you stapes connecting with the round window. Then I will show you incus between the two. Then I will show you Malleus connecting with the tympanic membrane. You want to see in a video? Have a look on the video. Appreciate. You can see this is inner ear. You can see this is labyrinth. You can appreciate this is the foot process of the stapes which is connecting with the round window. You can see this is incus. Okay, and you can see this is Malleus. This one is Malleus. You can appreciate this one is Incus and this one is Malleus. Again, see, you can see it again. So this is the foot process of stapes which is binding with the round window. This one is Incus. Appreciate the shape. Appreciate the parts I've told you. This is Incus and this one is Malleus. So this one is Malleus which is binding, and this Malleus will bind with the tympanic membrane. So this is how the things go. Okay, everyone got it? Okay. Now what are the joints? How many joints you can see it here? How many joints you can see? I can see 2 joints. What is a joint? Joint between 2 bones. It's a connection between 2 bones. You know the type of joints. You may have read this now in your first year. What are the types of joint? Yes or no? You have read this in anatomy or not? Yes. So tell me the joint between Malleus and Incus. Which joint is this? I'm asking you. Huh? And tell me the joint between Incus and Stapes. Incus and Stapes. What joint is this? Tell me 2 joints. Tell me the joint between Incus and Malleus and Incus and Stapes. So Incus is coming in both. So incus is the bone which is coming in both the joint. So what are the name of the joints? There are total 2 joints in ossicles. What are the 2 joints? The name of the joint is incudo. Incudo. Incudo means incus. Incudo malleolar joint and incudo stapes joint. Incudo malleolar joint. Incudo stapedial joint. Incudo means incus. Incudo means incus. I hope you are getting it. So I am saying incudo malleolus means this joint. And incudo stapedial, I mean this joint. So name the joint, people. First you have to learn these 2 names, then tell me the exact type of joint. You know synovial joint? Yes, both of them are synovial joint. Both of them. This is also synovial joint and this is also synovial joint. You can see I'm writing here. This one is synovial joint and this one is also synovial joint. Name the joint. It is incudo malleolar joint and incudo stapedial joint. Both of them are synovial joint. But which type of synovial? There are various types of synovial joint now. So the first one is the saddle type and second one is ball and socket. So this one is saddle type of synovial and this one is ball and socket. Ball and socket type of the synovial joint. Both of them are synovial. These all are your MCQs, people. Please focus. Please learn the 2 type of joints in the ossicles. Can we go ahead? Appreciate. What are the 2 joints? Can you tell me the 2 joints? One joint is here. One joint is here. Huh? Name the bones. Can you see the 3 bones? Appreciate. From lateral to medial. This is M, I, S. So name the joint between M and S. Say, ma'am, it's synovial. Okay. And name the joint between I and S. Say it's also synovial. But which type of synovial? This one, it is saddle type of synovial. And this one, it is ball and socket type of synovial. Everyone got it? People keep interacting. Give me thumbs up. Say, you can appreciate how these joints are moving. Appreciate the joints. Can you see? This is Malleus. You can appreciate this one is Malleus. Okay. This is Incus and this is Stapes. Okay. I want you to focus on this joint. This is saddle type. And I want you to focus on this joint, ball and socket type. So this is saddle type. This is ball and socket type. Both of them are synovial joint. People respond. Say, are you learning, enjoying, understanding with all these 3D illustrations? Yes or no? So that is the type of joints. Now what is the function of the ossicles? Why God has provided us these 3 ossicles? M-I-S. Why? They transmit sound vibration from where to where? From the tympanic membrane to the oval window. Appreciate the 3 ossicles. They are transmitting the sound vibration from tympanic membrane to the oval window. From tympanic membrane to the over window with an advantage. I will tell you how much advantage. Okay, so this is the function. I hope everyone got it. Now see this video, how they are transmitting. Appreciate the sound which is coming from Pinna. Appreciate. This is the tympanic membrane. Appreciate how the three ossicles are transferring it to the oval window and going to the inner ear. See it again. Appreciate the sound which is coming from the external auditory canal, hitting the tympanic membrane, then going to the ossicles, ossicles transferring the sound to the inner ear. I hope everyone got it. So we are done with the ossicles. Now coming on eustachian tube, the second component of the middle ear. We are done with external ear and now we are studying the middle ear. In the middle ear, I am interested in eustachian tube. I already taught you the three ossicles, MIS. In MIS, I told you which one is lateral, which one is medial, which one is largest, which one is smallest, and the joints between them and their structure. I told you all these things. Now coming on eustachian tube, people. Eustachian tube. What is eustachian tube? This is eustachian tube. Can you see this one? This one. It's a connection between the middle ear and the nasopharynx. Appreciate this tube. Appreciate this tube. This tube. It's the connection between the middle ear. Tympanic cavity means middle ear and the nasopharynx. Okay, so we have a tube over here which is connecting our middle ear, not external ear. Inside we have middle ear and inside the nose we have nasopharynx. So this tube here we have a tube. This side also we have a tube. So this is known as eustachian tube. You can see this is eustachian tube. It is connecting this tube. I'm talking about this tube. It is connecting the middle ear. It is connecting the middle ear with the nasopharynx. Since it is connecting the middle ear with the nasopharynx, it is also known as pharyngotympanic tube. What is the other name of eustachian tube? This is pharyngotympanic tube. You can see this is pharynx. It's nasopharynx. I will teach you in the pharynx, the three type of pharynx. Okay, the three portions of the pharynx. This is nasopharynx and this is tympanic cavity. I mean middle ear. Middle ear is also known as tympanic cavity. So it is also known as pharyngotympanic tube. Okay, you learned it. This is eustachian tube. Why God has given this tube? The tube between the ear and the nose? What is the connection between ear and nose? Why God has given such a tube? Why? To equalize the pressure between both sides of the tympanic membrane. Between both sides of the tympanic membrane to equalize the pressure. Let me show you. Can you see this is tympanic membrane? This is tympanic membrane. Here inside, I'm having my tympanic membrane like this. Okay, this is tympanic membrane. Now air is coming from here. Air is coming from here. So tympanic membrane will be like this. Okay, it will be pressurized like this. And it can rupture. Sometime with the air it can rupture. No. So the air will come. We also respire. No? Air is coming from the ears. Suppose there's a wind going on. The wind is going in my ears. But the same wind, I will respire. It will go in my pharynx also. And from the pharynx, it will come this side. So it will equalize the pressure. You got my point? What I mean to say. So this is the function of the eustachian tube. I will show you. Okay. It's 36 millimeter long. The external auditory canal was 24 millimeter. But this tube is 36 millimeter. I will show you. Okay. Here also lateral part, medial part. Lateral part is bony. Medial part is cartilaginous. And the connection between the lateral and the medial part is known as isthmus. The connection between the two is known as, the junction between the two is known as isthmus. Let me show you. Okay. We are done with middle ear. People, we are done with middle ear. Now I will show you the structures of the middle ear. Finally, last 5 minutes, I will show you internal ear. Then we will start the topic. Okay. So let me show you. Just a second. Middle ear. I want to show you the middle ear. You can appreciate. You can appreciate. We have already seen the three structures of the external ear. What are the three structures? This is pinna, external auditory canal, which is 24 millimeter long. Okay, which is 24 millimeter long. It's completely cartilaginous. There is no bone. Okay, but outer and inner portions have different curvature. We have already learned that. And there is tympanic membrane. Here it's in my hand. I will put it here back. So here is tympanic membrane. So this is external ear. In the middle ear, we are having the ossicles. These are the ossicles over here. I have shown you all the ossicles, their joints. You can appreciate their joints over here. I don't know whether you can see or not. These are the three ossicles over here. And this tube is eustachian tube. This tube is eustachian tube. Suppose it is air, wind. Okay, so wind will go from here. It will go from here, go from here, go from here, and it will compress the tympanic membrane. The air. Suppose air is coming. Okay. Suppose air is coming. So it's going inside, 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 inside like this. It will hit the tympanic membrane over here. So the tympanic membrane can rupture because of the pressure. But the same air we are respiring. So that's going in my pharynx, and from the pharynx, it's coming this way, and the same pressure coming this way. So tympanic membrane at the center. So whatever pressure of the wind or the air this side, so same pressure of the wind or the air this side. So it is equalizing. It is equalizing. You are getting it? It's equalizing the pressure both sides. What is the use of the, suppose this tube is not given. This is a tube, Eustachian tube. It is connecting the middle ear with the nasopharynx. This green color structure is nasopharynx. Can you see the green color structure? This is nasopharynx. So the length of this tube, what is the length? What is the length of this tube? It's 36 millimeter. This tube was 24 millimeter EAC, and this tube is 36. Okay, it is having outer part, inner part. Outer part is bony, inner part is cartilaginous. The junction between the two is isthmus. This is isthmus. Okay, and suppose this tube is not given by the cord. So only pressure of the air from this side. There is no air from that side. So tympanic membrane is a very, it's a membrane, it can rupture. So to equalize the pressure both sides, so whatever air pressure coming from this side, the same air pressure coming from this side. So it's equalizing. I hope you all got it. If you got it, if you are enjoying learning, understanding, give me a thumbs up. People, everyone, come on. Everyone, can we go ahead? Sure, we will. We will go ahead. Can we go ahead? Everyone. Yes. So let's continue. Yes. So we are done with middle ear. You got external ear? Huh? You got middle ear? Can I start inner ear? Let's start it. Let's start it. So let's start inner ear. Inner ear, we have two parts. It is the most difficult part to understand. I will not teach you complete inner ear over here. I will take a separate session on anatomy. It is already scheduled. You can check in the schedule. But here I'm just telling you so that you have a better understanding. So here we will see superficially what are the two portions in the inner ear. The two portions in the inner ear is labyrinth. Both of them are known as labyrinth. One is bony labyrinth. One is bony labyrinth. One is membranous labyrinth. Bony labyrinth, membranous labyrinth. What is bony and membranous labyrinth? First of all, the inner ear is an petrous part of temporal bone. You know, this is temporal bone. This is our temporal bone. This one. Okay, the petrous part of the temporal bone. So just behind this structure, behind the ear, this is mastoid antrum. Behind this, we are having the inner ear. Okay, so it is the petrous part of the temporal bone. First of all, you have to learn this inner ear. Now, the two structures I will take together. Bony labyrinth, membranous labyrinth. What is bony and membranous labyrinth? Bony labyrinth contain all these things. Membranous labyrinth also contain all these things. Most of the things are same. I mean, the structures are same. This is bony labyrinth. This is membranous labyrinth. You say, ma'am, they look same. Yes, they are exactly same. They are exactly same. Both of them have cochlea. This is cochlea. This is cochlea. Both of them have three semicircular canals. You can appreciate the three semicircular canals, which are perpendicular at the three axes. Both of them have the vestibule, the vertical and the sacule. Both of them have the verb. So you will say, what is the difference? No difference. Have you seen a tube, a tire inside a tube? Have you seen? You all must have some or other vehicle, whether two-wheeler or four-wheeler. But have you seen? There is a tube inside a wheel. What is the shape? They have exactly same shape. Only thing, the tube, this is tube and this is tire. The tube is placed inside the tire. Yes or no? This is relatively little bit smaller. This is relatively little bit larger diameter, so that this one can fit inside this like this. So tube is fitted inside the tire. Yes or no? This is the tube, this is the tire. Tube fit inside the tire. Both of them exactly same. Then only this will fit inside this. If little bit difference in the shape, structure, this will not fit inside this. So both of them are exactly same. Only the diameter of the tube is little bit less. The diameter of the tire is little bit more, so that this can fit inside this like this. Here we are fitting the tube inside the tire. Have you seen? We are fitting the tube. So it's like same. The bony labyrinth is the tire, inside which we will fit the membranous labyrinth, which is a tube. It is known as tube inside the tire. Tube, this one is tube inside the tire like this. Okay, you can see this is the tube. This one is membranous labyrinth. This one is membranous labyrinth, which is fitted in the bony labyrinth. Membranous labyrinth is fitted in the bony labyrinth. Everyone give me a thumbs up if you got this concept. Many of the students are still confused. What is membranous labyrinth? What is what? They both are exactly same. Okay, in Hindi if I say, ये bone का खांचा है, जिसके अंदर this complete membranous tube is fitted. It's a tube-like structure. Okay, inside which a fluid is there. Okay, it is fitted in the bone structure. पूरा खांचा बना है जिसके अंदर this one will go and fit inside like that. So this is bony labyrinth, like a tire inside which I will fit the tube. My tube is membranous labyrinth. Say yes, no, say something. Both of them have a fluid inside it. Suppose I'm filling a fluid over here. Suppose I'm filling a fluid. So I will fill the tire with the endolymph, and I will fill the tube with the perilymph. I'm sorry, I will fill the tire with the perilymph, and I will fill the tube with the endolymph. So I will put the endolymph inside the perilymph. You are getting my point? So same thing occur over here also. Okay, bony labyrinth filled with perilymph and the membranous labyrinth filled with endolymph. They have different concentration of electrolytes in them. I will tell you the exact concentration later on, the differences. But you understand, for now, you understand this much. How many of you got it? How many of you got it? You can see it's like this. So if I cut the structure from here, what I can see? If I see the cross section, I will see both. Inside I will see a tube and outside I will see a tire. Similarly, if I am cutting it like this, if I am cutting this structure, this one is already fitted inside this. Now if I cut this like this, if I am cutting it, this one is already fitted. So if I am cutting, I am looking like this. Can you see? It's looking like this. It's looking like this. So can you see? This one is the membranous labyrinth. Appreciate. This one is membranous labyrinth and this one is the bony labyrinth. Can you see? This one is bony labyrinth. So you can see this is the tire inside which this is the tube. This is the tire inside which this is the tube. Say, people, say. Yes, you got it. So complete structure. I am showing only a portion. Opening, cutting with a scissor, cutting it with a scalpel and opening it. So you can see outside is bone and inside the blue color is the membranous structure, a tube-like structure. So outside is the bony labyrinth, the gray color is the bony labyrinth and the blue color is the membranous labyrinth. Okay, the complete structure is like this. Complete semicircular canals, complete cochlea, complete article, complete vesicle, complete everything. But I am showing you only a portion. Everything have a membranous labyrinth and bony labyrinth. You can appreciate this is membranous labyrinth, outside which this is bony labyrinth. Got it? Say yes. Huh? So the membranous labyrinth is filled with endolymph and the bony labyrinth is filled with perilymph. So it is having perilymph over here as well as here, all around, perilymph. And this one in the center, there is endolymph. So there is endolymph at the center and perilymph all around. Got it? So there is membranous labyrinth is filled with endolymph. And the space between the membranous and the bony, the remaining all space, is perilymph. Everyone got it or didn't got it? Say something. First you respond, then only I will proceed. You got it? What I mean to say over here? What is bony labyrinth? What is membranous labyrinth? What is tire? What is tube? So tube is inside a tire. The tube, that is membranous labyrinth, is filled with endolymph. And the tire, which is surrounding the tube, is filled with perilymph. Each and everyone who is live, alive, awakened, and understanding everything, all criteria. Give me a thumbs up. Say, got it? Got it? It's difficult, people. I'm trying to give you 3D models here so that you can have an understanding. Just reading from the books, you will not understand anything. If you don't understand the basic, how you will understand the pathology? Now, in the next 20 sessions of ENT, I will teach you multiple diseases of external ear, middle ear, inner ear, various diseases with various surgeries to treat them. If you don't understand the basal structure, how you will understand the disease, pathology, and how you will understand the treatment, that is a surgery. If you understand things this, like from the base, understanding pathology and treatment will be fun for you. It will be cakewalk. Take my words. Okay, so base is very important according to me. Can we proceed? Chalo. So you got this thing. It was the most difficult thing of the session. If you got this thing, now things are simple. Now listen. I am not interested in complete labyrinth. In the labyrinth, we are having semicircular canals, which is not visible here. We are having vestibule, which contain article and saccule. I'm not interested here because these structures are vestibular system. They are responsible for balancing. You know, we balance now. Currently, I'm standing in front of you. I'm not falling like this and this. I'm having a balance. Okay. So balancing is done by this and this. I will teach you everything with live models, everything. Okay. But currently, I'm interested in cochlea. So labyrinth is having three portions, both bony as well as membranous. It is having semicircular canals. I'm not teaching you. It is having vestibule, article and saccule, vestibule, article and vestibule, article and saccule together known as vestibule. I'm not teaching you. I'm not interested in this. Not interested in this. I am interested in cochlea. Can you see the structure? Yes, this is cochlea. What is this? Cochlea. So cochlea is also having the bony labyrinth and membranous labyrinth like all other labyrinth. Yes. So I can see this is membranous labyrinth and I can see this is bony labyrinth. This is cochlea. So let's start the structure cochlea because this is the structure responsible for hearing. If you understand the structure, you will understand Rinne test, Weber test today. Now understand cochlea, the ultra important structure. So let's start cochlea. It's a spiral tube. How many turns it has? Can you count the turns for me, please? Huh? I can see 1 turn. I can see 1 turn, 2 turn, and 2.5. 1, 2, 2.5. You can count if you wish. 2.5 turn. It is having 2.5. So it's like I'm starting from here. 1 turn, 2 turn, and I guess till here 2 is done. I can see 1, I can see 2. Yes, 2.5. So this is 2.5. I will call this turn as 2.5 turn. It's like this only, if you can see. So this is 2.5. See the 2.5 turn. Appreciate the 2.5 turn. This is cochlea, the 2.5 turn structure. Okay, so this is bony cochlea, inside which the membranous labyrinth, membranous cochlea is there. The membranous cochlea is known as cochlear duct. I'm interested in cochlear duct, the membranous cochlea. 2.5 ton structure. Appreciate the inner ear. Appreciate this one. The 2.5 ton structure, the cochlea. The bony cochlea, inside which we have membranous cochlea. The membranous cochlea is the cochlear duct. Okay, now please understand, again a difficult portion. People, again, mind it. Please concentrate on your gadgets. Please, everyone. The cochlea, you understood what is cochlea? This is cochlea. Now, if I take a cross section of the cochlea, I can see 3 structures. Can you see? I can see 3 structures in the cochlea. These are the 3 structures. Listen, I will try. I will try once or twice, not more than that. So focus. You can see from here the cochlea is starting, 2.5 ton. Let's open the cochlea from any portion. Here it is opened. Okay. I can see 3 structures. What are the 3 structures? See. Everyone see. This is bony cochlea. Say yes, everyone. This is bony cochlea. Okay. And this is membranous cochlea. This one. This is membranous cochlea. Okay, I'm showing you. Wait. I will show you in a video also. So appreciate the black color is the bony cochlea, inside which there is membranous cochlea. So I divided the cochlea basically in 3 portions. What are the 3 portions? You can see the upper portion is known as scala vestibuli. The lower portion is known as scala tympani. And the central portion, which is membranous cochlea. These are 2 bony cochleas, side side. The central membranous cochlea is known as scala media. So we have 3 scala. You got my point? Say yes, say no, say something. I will try to draw. I will try to draw for you people. You have to understand this, people. If you understand this, then only I will teach you the test. Otherwise, if I jump on the test, you don't know the structure of cochlea, how you will interpret the test? People, understand. So suppose this is the cochlea. Okay? 2.5 ton. Okay, from here it's starting, for example. So this is the bony part. I'm not continuing it, but you can do so. So this is the bony part. Okay, this is the bony part and this is the membranous part. Okay, so can you see 3 portions over here? What are the 3 portions, people? This portion is known as scala vestibuli. It contains perilymph because it is in bony portion. This is scala tympani. Again, it contains perilymph because it is bony. But the central membranous one is known as scala media. It is membranous labyrinth. Okay, membranous cochlea, and it is also known as cochlear duct, the main cochlear duct. This is complete cochlea, inside which this is the cochlear duct. This contains endolymph. You got my point? Huh? I tried very hard. I cannot try harder than this, I guess. So this contains perilymph, this contains perilymph, but this one contains endolymph. Say people, say yes. So there are 3 portions in the cochlea. Not only here, in the entire 2.5 ton. You can continue these lines in the entire 2.5 ton. I'm just showing you here for the orientation. People say yes. Everyone? Huh? Now what are these 2 membranes which are separating? Listen. What is the name of this membrane which is separating scala vestibuli from the scala media? This membrane is known as Resoner's membrane. Okay. What is the name of this membrane which is separating scala media from scala tympani? This is known as basilar membrane. People focus on basilar membrane. Because this basilar membrane have organ of Corti. Now I will draw organ of Corti over here. That is the main organ of hearing. Cochlea is not main organ of hearing. On the cochlea, on the basilar membrane, we have an organ of Corti. I will draw it. And that organ of Corti sense the vibrations. And that organ of Corti converts sound energy into electrical energy that is transmitted to the brain and interpreted. Okay, whatever I am talking, you are understanding how my sound waves, waves are going to your ears, collected by your pinna, going inside, reaching here. Acha, this is inner ear. What is before inner ear? This is inner ear, not cochlea. Before inner ear, here we have middle ear. You remember middle ear or you forgot it? Let's try. This is middle ear. In the middle ear, we are having 3 ossicles, M-I-S. You are remembering it? Let's try. This is M, this is I, and this is S. I'm not drawing this exact shape. I'm just orienting you. This is Malleus, this is Incus, this is Stapes. My point is that my point is that Stapes ka footplate. Stapes ka footplate, I told you, na? It is connected with a round window. And round window is connected with scala vestibuli. Got it? Round window is connected with scala vestibuli, the upper one. So this is scala vestibuli, scala media, and scala tympani. The vestibuli and tympani are bony labyrinth. They contain perilymph. The scala media is the membranous labyrinth. Okay, it contains endolymph. So outside we have a tire, inside which we have a tube. The tire contains the perilymph, but the tube contains the endolymph, like that. You can see the two membranes which are separating. So the upper membrane is resiner membrane, which is not very important, but it is separating the vestibuli from the media. And the lower membrane is the basilar membrane, which is separating the media from the tympani. Got it? Now here, MIS, the stapes is connected with the vestibuli. Got it? You will say, ma'am, are they connected anywhere? No. I mean, yes. I mean, vestibuli and tympani, the first and the last, first and the third, they are connected at the apex. At the apex, they are connected. Like this, they continue. At the apex, the bony, both the bony are connected with each other. But membranous is not connected with them. Okay, so perilymph mix with each other, of both of them. But endolymph is separate. I hope you are getting it. I tried from the depth of my heart. Say yes, people. Everyone. Everyone say. Got it? Can we go ahead? Can we go ahead? Okay, yes. Okay, so this is the structure. This is the structure of the cochlea. I hope I have explained you. So can you see this cochlea? Yes. Can I cut it? Open it with a scalpel, scissor. Open it. Can I show you the 3 portions over here? You can see the 3 portions I am drawing over here. Okay. This is scala vestibuli, scala tympani, in the center scala media. Can I show you? These are the 3 portions. You can appreciate these are the 3 portions. Appreciate. This is the foot process of stapes. Okay. It is connected with scala vestibuli. Okay. This is scala tympani. And between the two, this one is scala media. So scala vestibuli, scala tympani, scala media. The scala vestibuli is connected with the middle ear via foot process of stapes. And the vestibuli and tympani both contain perilymph. This also contains perilymph because both are bony labyrinth. Inside, these are tire. This is tire. Inside which there is a tube. The tube contains the endolymph. The tire is connected with each other. Okay, at the apex, and the connection is known as helicotrema. The connection is known as helicotrema. Let me show you. Please focus. Please listen. Can you see this is scala vestibuli? Can you see this is scala tympani? I'm interested in the first and the third, not the middle one. Middle one is a tube, membranous. See the first and the third. They are like this, like this, like this. See my hand ka movement. See again. See the first and the last. First and the third. They are like this, like this, like this, like this, like this. But mind this point. At this, both of them are connected. This point is known as helicotrema. The apex of the 2.5 ton. The apex of the cochlea. It is known as helicotrema, where they are connected. And the perilymph is mixing. Okay, so this is tire, inside which there is a tube. I hope you got it. You got the meaning of the helicotrema. What is helicotrema? At which scala vestibuli and scala tympani are connected with each other. Say yes. I told you regarding the 2 membranes. Yes or no? What are the 2 membranes I told you? Basilar membrane and Resner's membrane. So this one is Resner membrane, which is separating vestibuli from the media. And this is basilar membrane, which is separating media from the scala tympani. Okay, so this is Resner's membrane and this is tympanic membrane. Resner's membrane separate from scala vestibuli, media from vestibuli, and basilar separate media from the tympani. Got it? We are interested in basilar membrane. Sorry, this is not tympanic membrane. This is basilar membrane. We are interested in basilar membrane. Resinal membrane, basilar membrane. On the basilar membrane, we will be having. So can you tell me which membrane is this? Here. Can you mark it? Can you mark it? Last time. Last revision. Last time. Huh? You can see in this diagram. This is bony labyrinth. Okay. And this is membranous labyrinth. Okay. Here you can see scala vestibuli, scala media, scala tympani. Okay. So this membrane is resinal membrane, which is separating vestibuli from media. And this is basilar membrane, which is separating media from tympani. Am I right? I guess you oriented. Huh? Let's cut it from here and see the cross section view. Let's cut it from here like this and see the cross section view. It looks like this. It's look like this. I will see three cavity. The first cavity, upper cavity, middle cavity, lower cavity. The upper cavity is vestibuli. The middle cavity is media, cochlear duct. And the lower cavity is tympani. Appreciate the three cavities. The upper and lower, the blue color, contain the perilymph. Okay, this is scala vestibuli. This one is scala tympani. They contain perilymph. The middle one is scala media. Okay, cochlear duct. And it contains endolymph. The white one, it contains endolymph. Okay, appreciate the membrane. This membrane, which is separating vestibular from media, it is Resner's membrane. And appreciate this membrane, which is separating media from tympani. It is known as basilar membrane. And on basilar membrane, we are having organ of Corti. That I will explain. Okay, I guess everyone got it. No one is asking the question, so I think everyone got it. So let's come on the last thing, organ of Corti. What is organ of Corti? Organ of Corti is the sense organ of hearing, and that is present on basilar membrane. You can appreciate on the basilar membrane. On the basilar membrane, the organ of Corti. This is organ of Corti. Let me zoom it out to show you what structures it is having. So this structure is present on basilar membrane in the cochlea, the 2.5 ton cochlea. On the basilar membrane which is separating scala media from scala tympani. This basilar membrane is having organ of Corti, which is having four structures in that. Four structures. These are the four structures. You can see. I will zoom it out. Okay, I'm zooming this portion. Organ of Corti, which is present on basilar membrane to show you. So this is the zoom version. You can see this one, or you can see better this one. Appreciate the basilar membrane. Now you can orient. This is basilar membrane. This is the organ of Corti present on the basilar membrane. Okay, it is having four things. What four things it is having? Let me show you. It is having inner hair cell. It is having outer hair cell. Inner hair cell, outer hair cell. Between the inner and outer hair cell, there is tunnel of Corti. Organ of Corti have tunnel of Corti. Tunnel of Corti. Inner hair cell, outer hair cell. And these all are supporting cells. And there is a tectorial membrane over it. Okay, so this is the structure of organ of Corti. Again, I will teach you again in detail when I will teach you the anatomy. So tunnel of Corti, inner and outer hair cell, supporting cell, and tectorial membrane. So this is complete structure of the ear. We are done with the anatomy of the ear. I hope you got it. You want to see the cochlea? I'm having it with me. We'll try to show you. So we are done with ear. The anatomy, I mean. Okay, you can see the complete anatomy is done. People, complete anatomy is done. Okay. You can see external ear. In the external ear, we have pinna, we have external auditory canal, and we have tympanic membrane, which is obliquely placed. You know their size, you know their curvature, you know their function. Now we have middle ear, in which we have the three ossicles. They are fitted over here. You can see these are the three ossicles along with eustachian tube. You can see it's a connection between the middle ear and the nasopharynx. And the inner ear, which is present in the pectoral part of the temporal bone. I have opened the bone in front of you, I guess, if you are watching my session from the beginning. So I guess this one is the pectoral bone. It is fitted like this. Okay, if I open it, so it is inside the pectoral part of the temporal bone. You can appreciate. I will show you all these things later on. Okay, so this is the pectoral part of the temporal bone, inside which we have the inner ear. This is inner ear. Appreciate the bony labyrinth. I can show you only bony labyrinth. Appreciate it. Bony labyrinth, inside which there is a membranous labyrinth. I can show you the tire. Inside which there is a tube. Okay, I can open it a little bit, but it is not completely opened. But I can open it a little bit. I mean, I can open the cochlea, I guess. It's having a screw in that. It's tight. Let's try. It's opened. So it is having the membranous labyrinth inside that. Got it? So there is a tube inside which there is a tire, and you can appreciate the 3 semicircular canals are there. You can see this is the vestibule and this is the 2.5 ton cochlea. So this is the inner ear. In the cochlea, I told you the detailed structure of the cochlea, the 2.5 ton, the membranous cochlea, the bony cochlea, the 3 portions of the cochlea, scala vestibuli, scala media, scala tympani, the 2 membranes which are separating it, Resner's membrane, basilar membrane, and on the basilar membrane, the organ of Corti, which contain the hair cells, most important. These hair cells, inner and outer hair cells, convert the sound energy into electric energy. I hope this is a complete structure, and this is the auditory now. I will show you in the physiology. So I guess this is the best anatomy I can give till date. Yes or no? So we are done with the anatomy of the ear. Let's proceed further. Anatomy is done. We have revised it yet. Further, multiple times. Cochlea, we have revised it. In this portion, the most difficult portion is cochlea. Okay? So we have also revised that. So next 5 minutes, we will continue with the physiology of ear. Okay, only one flowchart. That's it. And after that, I will come on the test. Can I do? So you understand the physiology. How does we hear the sound? I'm talking. I'm teaching you. Are you listening? You can listen only if you can hear. Are you interpreting what I'm saying? How it is done? What is the complete pathway? So if I'm talking, my sound waves, which are invisible, okay, they are invisible. They are coming from my mouth. They are going to my mic. I'm having a mic over here. This is my mic. So they are via mic, via internet. It is reaching to you. Okay. And it is captured by your pinna. Then what happens ahead? Tell me the complete flowchart till the auditory area in your brain. What is the auditory area in your brain? Brockman's area 41. So how the complete auditory pathway is there? Tell me the physiology of the ear. Quick, fast. So one by one we will see. You can see first of all, the sound signal is collected by the pinna. Whatever I am talking, you are perceiving with your pinna. So pinna collects the sound. First of all, you can see. After that, it is passed through external auditory canal. The sound is passed through external. I will show you a video also. So sound is collected by pinna, passed to external auditory canal. Then it goes to the tympanic membrane. It hit the tympanic membrane. Collected by pinna, passed through EAC, hit the tympanic membrane. After hitting the tympanic membrane, it vibrates the ossicles, M-I-S. So you can see this is M, this is I, this is S. They are vibrating. I will show you a video. They are vibrating. Finally, S is vibrating. Finally, S. This S, which is vibrating, the foot plate of Stapes, which is vibrating, it is connected with scala vestibuli. Okay, it is connected to scala vestibuli. I told you, no? So this is the foot plate of the Stapes. It is connected here. You can see it here also. So this is the foot plate of Stapes, you can say. So in the cochlea, there are 3 portions. No? These are the 3 portions. So this one is connected with scala vestibuli. Then there is scala, media and tympani. But vestibuli and tympani are connected with each other at helicotrema. So sound waves goes to vestibuli and via helicotrema, it is going to tympani. Okay. So the sound waves are coming to the Stapes. Okay, again say from the beginning. The sound is collected by pinna. Yes, this is pinna. From pinna, suppose this is pinna. From pinna, it will go to EAC. Okay, from EAC, it will go to tympanic membrane. This is tympanic membrane. Pinna, EAC, tympanic membrane. From tympanic membrane, it will go to MIS. Okay, in the middle ear, this is M, this is I, and this is S, as is shown to you. M, I, S. The foot plate of the Stapes, okay, it is passing to scala vestibuli. Scala vestibuli is connected with scala tympani at helicotrema. This is helicotrema. It is going to scala tympani. When it goes to scala tympani, the basilar membrane vibrate. On the basilar membrane, we have organ of Corti. Okay, so sound is reaching. It is vibrating the basilar membrane. On the basilar membrane, we have organ of Corti. On the organ of Corti, we have hair cells. Okay, on this basilar membrane, we have organ of Corti. You see this. This is basilar membrane. This is organ of Corti. Okay, so via foot plate of Stapes. Foot plate of Stapes. This is Stapes. Foot plate of Stapes. The sound is coming to scala vestibuli. Via helicotrema, it is coming to scala tympani. Scala tympani, it is vibrating the basilar membrane. Basilar membrane is vibrating. It is transmitting it to the hair cell. It is transmitting to the hair cell. Hair cell convert sound energy to electrical energy, that is known as transduction. People mind my words very carefully. Hair cells are transducer. Main hair cell ही है अंदर. Hair cell convert the sound energy to electrical energy. Convert the mechanical energy to electrical energy. That is transduction of energy. One type of energy converted to other type of energy. Transduction of energy. Who is doing so? The hair cells. Outer hair cells, inner hair cells. They are converting the sound energy to mechanical energy. After converting from the dendrites of hair cell, eighth nerve arises. Eighth nerve, cochlear nerve. Okay, eighth nerve arises. And it goes to the eighth nerve. Via eighth nerve, it goes to the brain. Okay, so from the dendrites of the hair cell, from the dendrites of the hair cell, it is going to eighth nerve, auditory nerve. Auditory nerve had two components, cochlear and vestibular. So it is going to the eighth nerve. You know, cranial nerves, 12 cranial nerves. This is the eighth nerve. Okay, and it is going to the brain, area 41. How many of you got it? People respond. Who's watching it? Got it or didn't got it? The complete physiology. You can see it here. I tried. First, I will revise it here. Then, where is that diagram? Yes. Then I will show you the video. Say, people, my ear. Huh? Someone is saying something. I can collect it with my pinna. This is my pinna. See my pinna? See this. So I'm collecting the sound in the pinna. It is going to my EAC. Then it is going to the middle ear it is going to tympanic membrane. It is striking the tympanic membrane. Then it is going to ossicles, vibrating the ossicles. M-I-S. You know the joints between them. The S. The foot plate of S is connected with the scala vestibuli. So it is going in the perilymph of scala vestibuli. Scala vestibuli perilymph is connected with scala tympana at the helicotrema. Via helicotrema, it's going to scala tympana. When it is going to scala tympana, sound waves. These all are sound waves going. Okay, it is vibrating. So it will vibrate the basilar membrane. You know, basilar membrane is what? On the basilar membrane, we have organ of Corti. On the organ of Corti, we have hair cells. So sound energy is reaching the hair cell, which is converting the sound energy, mechanical energy into electrical energy. This is known as transduction, the most important step in hearing. If sound energy cannot be converted into electrical energy, how will it be transmitted to the brain? And from here, the hair cell, the dendrites of the hair cell will continue as eighth nerve and they will go in the brain. Further pathway I will show you in the brain. It is not the end of the story. Further pathway I will show you in the brain. So you can see it here. We can see this is tympanic membrane. Appreciate the umbrella shape. Appreciate this is M. This is I. I'm not interested in M. I'm not interested in I. I'm interested in S. Stapes. I'm interested in foot plate of the stapes. It is connected with scala vestibuli. Scala vestibuli is connected with scala tympani at the helicotrema. Appreciate the helicotrema. This is scala tympani. And when scala tympani is vibrating, it is vibrating the basilar membrane. And on this basilar membrane, it's very minute, not visible here. You can see it here. It's vibrating. So the organ of Corti gets stimulated. The hair cells get stimulated. They convert the sound energy into electrical energy and it is transmitted to eighth nerve to the brain. Eighth nerve से brain तक कैसे पहुंचा? How it reaches from the eighth nerve till brain? I will tell you further in the next slide. But here I am ending on the eighth nerve. I am ending on the hair cells and hair cells का dendrites are eighth nerve. From eighth nerve, how it reaches to brain? There are multiple steps in between. I will tell you that also. Everyone got it? Everyone got it? You can see it here. It is via eighth nerve, it will reach the brain. First, it is reaching to the hair cell, and from hair cell, how it via eighth nerve, it is reaching the brain, I will tell you. Can we revise the complete pathway once? I will write it. Say, sound is coming in my pinna. This is my pinna. Sound is coming in my pinna. Say, yes, it's coming. So, sound comes in the pinna. Pinna. From pinna, it goes to external auditory canal. You imagine. From external auditory canal, it goes to tympanic membrane. From tympanic membrane, it goes to ossicles. Ossicles में M, followed by I, followed by S. S is stapes. The foot plate of the stapes is connected with the cochlea. Cochlea में there are three portions: scala vestibuli, scala media, scala tympani. So it goes to scala vestibuli. Scala vestibuli is connected to scala tympani via helicotrema. So via helicotrema, it's going to scala tympani. Scala tympani is vibrating the basilar membrane. On the basilar membrane, we have organ of Corti. So organ of Corti gets stimulated. On the organ of Corti, we have hair cells, outer and inner hair cells. These hair cells convert the mechanical energy to electric energy, and that is the most important step. That is known as transduction. Okay. Now the dendrites of these hair cells form the eighth nerve, and via eighth nerve it reaches to the brain via 6 stoppage in between, and the mnemonic of that 6 stoppage is E. colima. I will come on with E. colima. These are the stops 1, 2, 3, 4, 5, 6. So eighth nerve reaches the brain via 6 stops in between. I will come on that. Finally, it reaches the brain, and we can interpret whatever we are hearing. Whatever I hear, I interpret only in my brain. So the sound which is coming here should reach my brain after converting into electrical energy. Then only we can interpret it. So this is the physiology. Say people say yes. Okay, so this is the complete physiology, the complete flowchart. Appreciate whatever I have drawn here, the same thing is written here. Say people, you can see all the steps. I'm not reading. The last step here is the hair cell. From the hair cell, it's the eighth nerve. And from eighth nerve, how it is reaching to brain. Okay, so you can appreciate this video. So appreciate the complete pathway in a video. It's very fast, so kindly focus. You can see this is the sound which is coming. It is going in Pinna, then external auditory canal, hitting the tympanic membrane, going in the ossicles from the footplate of the Stapes. It is going in the organ of corti, and via eighth nerve, it is reaching the brain. See it again. How from the eighth nerve, this is eighth nerve. How it is reaching to the brain, that is neural pathway. Okay, so I will teach you that in neural pathway. So let's come on the neural pathway. So from the eighth nerve, here I am ending at the eighth nerve. So how from eighth nerve, it is reaching the brain. How it is reaching the brain? So let me tell you in the neural pathway. So can I start? Neural pathway. So hair cells, the dendrites of the hair cell form eighth nerve. You know where are hair cell? Hair cell, the outer and inner hair cell, they are present on organ of corti. Where is organ of corti? On the basilar membrane. You remember? So on the basilar membrane, we have organ of corti, we have hair cells. So how sound was reaching there? We know the complete flow chart. This is the complete flow chart. How it is reaching till hair cell. We have completely seen it. From hair cell, how it is reaching the brain. I'm telling you that. So the dendrites of the hair cell form the eighth nerve. And how it is reaching to the brain, I'm telling you that now. Got it? So that is neural pathway in the brain now. Eighth nerve onwards, it's in the brain. Neural pathway. So hair cell, the dendrites of the hair cell form the eighth nerve. Cochlear nerve, eighth nerve, whatever you say. Okay. Now, it will go to cochlear nucleus. Then it will go to olivary complex, superior olivary complex. Then it will go to lateral lemniscus. Then it will go to inferior collicus, inferior colliculus. Okay, this is cochlear nucleus, olivary complex, lateral lemniscus, inferior colliculus, then medial geniculate body, and finally the area 41 of the brain, the Brodmann area 41 of the brain. Okay, that is auditory cortex. Say, ma'am, how to learn that? Don't worry, I'm having a mnemonic, very easy mnemonic. The mnemonic, you can see the complete diagram. Can you see the hair cells? Where are the hair cells? These are the hair cells. The dendrites of the hair cells form the cochlea, from the cochlea, the dendrites of the hair cells, they are forming the eighth nerve. Appreciate this is the eighth nerve. So this eighth nerve is going to cochlear nuclei. These are cochlear nuclei. Then it's going to superior olivary complex. This is superior olivary complex. Then lateral lemniscus. Then inferior colliculus. Then medial geniculate body. And finally area 41. You should be able to draw this. I guess you have read this in your anatomy in your first year, if you have read anatomy anyways. So this was there. This is auditory pathway. So the mnemonic is E. colima. Very easy mnemonic to learn. So E for eighth nerve. E for eighth nerve. C for cochlear nucleus. Okay. O for olivary complex. O for olivary complex. L for lateral lemniscus. LL, lateral lemniscus. Okay. I is inferior colliculus. Olivary complex, lateral lemniscus, inferior colliculus. Inferior colliculus. M is medial geniculate body. And A is auditory complex. That is area 41. Brodmann's area 41. Say now, can you mark it? E. colima over here in this flow chart. Say what is E. colima. You can see E-C-O-L-I-M-A. E. colima. E. colima. Say, you can see it here if you wish. E. colima. You can see all the structures of E. colima over here. How the sound waves are transmitted via E. colima. So what's the summary, people? Can you tell me the summary? We are done with physiology. Let's start the test now. I know it took time. Okay, half of the portion of the lecture I told you the anatomy and physiology, but it was necessary, people. Okay, it is not my way of teaching. I can directly jump on the topic. Whether you understood or not, I can start from high fun, do things. No, no, no. Now the topic, you have understood the anatomy and physiology well. Now you yourself realize how easy the test will be. I will perform in front of you with tuning fork. I'm having tuning forks. All the tests I will perform, and you have a very better understanding. Believe me. Okay, chalo. Tell me the summary of physiology first. Who will tell me the summary of complete physiology? Sound is collected by Pinna. From Pinna. This is my Pinna. I'm collecting the sound. I'm collecting the sound with my Pinna. It will go to EAC. You imagine the diagram. From EAC, it hits the tympanic membrane. From tympanic membrane, it vibrates the ossicles. 3 ossicles. M, I, S. The footplate of the S is continuous with cochlea. Cochlea का कौन सा portion? Scala vestibuli. The perilymph in the scala vestibuli via helicotrema, it is continuous with scala tympani. Okay, so scala tympani vibrate. Scala tympani vibrate basilar membrane. On the basilar membrane, we have organ of corti. On the organ of corti, we have hair cells, outer and inner. They are most important cells. They convert mechanical energy, sound energy into electrical energy, and this is transduction. Okay, so this is transduction, complete conduction of sound. After that, now we start the neural pathway. The dendrites of the hair cell continue with 8 now. The dendrites of the hair cell continue with 8 now. Okay, so 8 now, E, O, L, Ma. 8 now, cochlear nucleus, olivary complex, lateral lemniscus, inferior colliculus, medial geniculate body, and auditory complex, area 41. Finally, in the brain, auditory complex. So in the complete pathway, this is complete physiology. Okay, on 2-3 pages, you can draw with the diagrams like this flowchart, and you can explain all the steps. Say, I'm dividing it into 3 portions. They are in front of you. One portion is in red. Okay, one portion is in black, this portion, and one is in blue. The red portion from Pinna till organ of corti, this is known as conductory pathway, conduction of sound. Conduction. The sound is conducted. Simply it is transmitted and conducted. Conduction means simply आगे transmit करना. This is transmitting to this. This is transmitting. This is transmitting to this. This is this. So conduction of sound. Okay. This is known as transduction of sound. The second step. Transduction, where conversion takes place. Energy is converting. One type of energy converted to other. I mean, sound energy is converting to electric energy. That is transduction. And this is known as neural pathway. Neural in the brain. Neural from 8 now onwards. E. colima is neural pathway. This is neural pathway. People say this is conduction pathway. This is transduction pathway. This is neural pathway. At least I tried the complete physiology of hearing in one shot. Say, you got it or you didn't got it? This is how we hear. Don't only hear. This is how we interpret the sound. The complete pathway. First conduction takes place, then transduction of energy takes place, and then neural pathway is there. Now, let's start. Let's here only start the topic. Hearing loss. That was my topic today. I'm sorry I'm late to start that. I'm really sorry. But believe my words, you have a better understanding now. And you won't regret your decision that first you understand the base. Without forming the base, how I can build the building behind that? I cannot. Now you understand it. Okay. Now there are 2 types of hearing loss. If there is any obstruction from here till here, it is known as conduction hearing loss. Conductive hearing loss. Okay. This is known as conductive hearing loss. And if there is any problem in this portion, it is known as sensory neural, this and this, sensory neural hearing loss. So I will teach you 2 types of hearing loss. Conductive hearing loss, if the problem exists from here till here. And sensory neural hearing loss, if the problem exists here or here. Sensory, means the problem here. And neural, the problem is here. Sensory neural. So this is sensory neural hearing loss. Sensory neural hearing loss. So 2 types of hearing loss. Conductive hearing loss and sensory neural hearing loss. People say, respond, say something. You got the 2 types of hearing loss, what I am saying? Let's try. Let's try. The two type of hearing loss. Conductive hearing loss and sensory neural. Sensory neural. Neural is again of two type. Neural is again of two type. Cochlear and retrocochlear. If the problem exists in E means eighth nerve, it's cochlear. And if the problem exists in colima, if the problem exists inside the brain, colima, anywhere, COLIMI, it's retrocochlear. Cochlear ke piche, retrocochlear. So sensory neural deafness is of two type. Sensory neural deafness is of two type. Neural is of two type, cochlear and retrocochlear. So sensory neural. Neural is again of two type, cochlear, retrocochlear. Everyone give me a thumbs up. Everyone. Got it? So let's start the topic. I hope everyone got it. Okay, so that was a summary. You can see this video. The complete this flowchart. Starting from Pinna till auditory complex area 41 of the brain. See it again. I will show in one video. Focus on this video. Starting from Pinna, it is very fast. Starting from Pinna, you observe all these steps in that video till how it reaches reaching the area 41 of the brain. I will show you conductive pathway as well as transduction as well as neural pathway. Are you ready for the video? Shall I play it? Are you ready for the video? Say yes. So let's start it. You can see it. It's very fast, huh? You can see sound energies are coming here. Okay, you can appreciate it. You can appreciate in the middle ear how ossicles are moving. It is going to the inner ear. Appreciate it. In the inner ear, you have appreciated it. Now it's going to the eighth nerve. Via eighth nerve, this is equally. Okay, you got it. Start with the Pinna and end with equally. Appreciate how it is going from the Pinna to EAC to MIS. From S, how it is going to the middle ear, then inner ear, and then eighth nerve. And via eighth nerve, it's going to equally. So everything is shown in this video. I guess you understood it. So this is the complete physiology. I told you it is having three pathways. Conductive apparatus, transduction of the energy, and then sensory neural apparatus. Okay, the complete red one is the conductive one. And the blue one, this blue one is the transduction. And the lower purple one is the sensory neural. I hope you understood it. Okay, let's start the topic hearing loss. Let's start it. What are the type of hearing loss? I already taught you. So we have three type of hearing loss. Conductive hearing loss. You know where the problem exists. Now, you tell me, I can start with this slide also. I wish 1.5 hours back when I started the session at 6 o'clock, I can start with this slide. Okay, if I wish, because it is my topic, hearing loss today, assessment of hearing loss. So I can start, but can you understand what is conductive hearing loss, sensory, unless until you don't know the physiology, huh? That flowchart from Pinna to area 41, you can't understand. Huh? How you can understand the physiology if you don't know the anatomy? That's why it took time, but now you will understand. So this is conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. Conductive don't have any time, mixed don't have any time, but sensory neural is of two type. Okay, it's cochlear and nuclear. Okay, cochlear and neural. Neural mate is of two type, retrocochlear and the central. So we will differentiate them. Whether the treatment of all of them differ. Treatment of conductive is differ. Treatment of sensory neural is different. Sometimes it is mixed, both of them. Okay. So to treat a person, suppose I am a ENT specialist and there is a patient coming with a deafness. So first of all, via various tests, I want to know whether the deafness is conductive or sensory neural or mixed. If it is sensory neural, is it cochlear or neural? If it is neural, is it retrocochlear or is it central type? Because treatment of all of them differ, prognosis of all of them differ. Okay, we cannot treat all deaf persons with the same treatment, of course. So we have to perform certain tests, certain clinical tests, certain audiometry tests, various tests are there. So that test we will study now. Okay, yes, got it. So this is the classification of hearing loss you have to learn, and now we will come on the test. First you tell me the definition of the three type. Let's start with the conductive. What is conductive hearing loss? What is conductive deafness? Conductive hearing loss. What do you mean by conductive hearing loss? Conductive deafness. It is caused by disease anywhere. Just a second. It is caused by disease from the external ear, that is Pinna, till stapediovestibular joint. I mean from Pinna, if disease is anywhere till MIS, S ka junction, that is external ear and middle ear. What are the parts of external ear? We have Pinna, we have external auditory canal, we have tympanic membrane. So if there is problem in pinna, problem in external auditory canal, problem in tympanic membrane, or problem in the ossicles, that is MIS, or problem in the eustachian tube, anywhere if the problem exists, it is conductive. This deafness is known as conductive deafness. External ear and middle ear is conductive, in short. So conductive deafness is any problem in the external ear or middle ear, not inner. External or middle is conductive hearing loss. So what is the site of the lesion? It can be external ear, it can be obstruction, maybe wax, maybe foreign particle, maybe anything in the external. Wax is very common. Okay, so wax is very common in the external auditory canal, and sometimes it can lead to partial deafness. Yes or no? So it can be any obstruction in the external ear. Okay, tympanic membrane perforation. Sometimes using the buds. Buds should never be used. Okay, for cleaning the ears, many people use buds. No, you don't know how deep it is going. If you are putting a bud, I will show you a video, and it can perforate the tympanic membrane. If the tympanic membrane perforate, how it will vibrate? So vibration of the ossicle will stop, and the sound energy will not be transmitted ahead. Got it? So perforation of the tympanic membrane, either obstruction in EAC or perforation of the tympanic membrane, or there is fluid in the middle ear. In the fluid ear, in the middle ear, sometimes fluid is filled. That is causing dampening of the vibrations of the ossicles. That is known as serous otitis media. There are various types of serous otitis media. It's a big topic. I will teach you in detail. So fluid in the middle ear. Fluid in the middle ear can be there. Or ossicles ke junction, joints. I told you two joints, na? Saddle type and ball and socket joint. That get fixed or disrupted. You can see this joint, or you can see this joint. The two type of joint, they get fixed. They are not vibrating. They get fixed or disrupted. Either fixed or dislocated. So that can happen. That can happen. Or eustachian tube obstruction. If the eustachian tube is obstructed, so air is coming only from this side, not from this side. So that can cause tympanic membrane perforation. Okay. So that can be the causes. So these are the causes of conductive hearing loss. So conductive hearing loss lies from here till here. That is from pinna till Stapes vestibular junction. It includes external ear, it includes middle ear. It includes all these causes in the external and middle ear. That is conductive hearing loss. So after conductive, you can see it here. So if there is obstruction over here, okay, sound waves will not be transmitted. If there is perforation over here, sound waves will not be transmitted. If there is disruption over here, so ossicles will not vibrate. Okay, or there is obstruction in the eustachian tube. So again, tympanic membrane perforation can lead to. These are the causes of conductive hearing loss. Now coming on sensory neural hearing loss. So any lesion from cochlea, okay, from cochlea or eighth nerve and its central connection. So from cochlea itself, from here till E colima, anywhere, E colima ka A, from here till here, it's sensory neural. It's sensory neural. It is of two types, retrocochlear and central. If there is a lesion in the eighth nerve, that is E, that is retrocochlear. And if there is a lesion in colima, anywhere in the colima, you know the full form of colima, anywhere in the colima, it is central. So it is of two types. So if there is a lesion in the eighth nerve, it is retrocochlear. And if the lesion is in the colima, this is E, and this is colima. So there is a lesion in the eighth nerve. If there is a lesion in the eighth nerve, it's retrocochlear. And if there is a lesion anywhere in the colima, it's central. So these are the two types of sensory neural deafness. I hope you all got it. You can appreciate this is eighth nerve. And eighth nerve proceed to E colima. So lesion in eighth nerve, retrocochlear deafness. Lesion in colima, it's central deafness. So these are the two types of sensory neural. Everyone got it? Everyone, and mixed contains both component. It contains conductive hearing loss as well as sensory neural. In some diseases it occurs like otosclerosis, PSOM. I will teach you all of them. We are having 20 lectures of ENT. Don't worry. I will teach you all of them. Okay, so that is the classification. Now, let's start the real chapter. Assessment of hearing loss. We understood the classification. These are the type of hearing loss. But how to assess whether my patient is having this one or this one or this one? If it is this one, whether it is this one or this one, how we come to know that? I want to perform test. Yes or no? Can I start the test? Can I start the test? So first of all, why to perform test? Is it necessary to perform a test to know the type of deafness? Why? What is the goal? Why you want to perform the test? Hearing test. Assessment of hearing. for 4 goals. We are having 4 goals to perform the test. Before performing the test, you should know their goals. Number 1, we want to know the type of hearing loss among them. Is it conductive or sensory neural or mixed? Based on which treatment will differ. So we want to know the type of hearing loss. Which type of hearing loss my patient is having? Is it sensory neural? Is it conductive or is it mixed? Based on which my treatment will differ. So I want to know the type of hearing loss. Number 1, type of hearing loss. Number 1. Number 2, I want to know not only type, I want to know its degree also. Suppose it's conductive, but is it mild or moderately severe or profound or total? Based on which again my treatment can differ. Prognosis obviously will differ. So I want to know the degree, how much. First I want to know the type, whether the person is having conductive hearing loss or sensory neural or mixed. Then I want to know its degree. Is it mild, moderately severe, profound or total? So I want to know the degree. So I know the type, I know the degree. Then I want to know the site of lesion so that I can treat it precisely. Exact site of lesion. In conductive, it can be in the external ear, tympanic membrane, middle ear, ossicles or eustachian tube. What is the exact size? In sensory neural, it can be cochlear, retrocochlear or central. Okay, so what is the exact location? I want to know. After that, I want to know the cause. What is the cause of the deafness? Is it congenital? Okay, some deafnesses are congenital in origin. By birth they are. Sometimes it is due to trauma, most common, in some accident, in some trauma. It can be infective. It can be due to cancers. It can be degenerative, metabolic. It can be due to ototoxic drugs or vascular or autoimmune phenomenon. So among these causes, what is the cause? So there are 4 goals, people. What are the 4 goals? Why we want to perform the test? How will come on the test? My next slide is test only. These all tests I will teach you one by one. We will do clinical test, audiometric test and special test. Okay. But before that, why we want to perform such all these tests? Why? There are 4 goals. Some tests among them tell us the type of hearing loss. Is it conductive or sensory neural or mixed? Some of them tell us the degree. Is it mild, moderate or profound or severe, like that? Some of them tell us the exact site. Okay, and some of them tell us the cause. So because of these 4 goals, we want to perform the test. See people, can I start the test? How many of you are ready? Can I start the test? Let's start the test of hearing. Let's start the test of hearing. So this is the topic. These all tests we want to study in detail. We divide the test into 3 categories. So there are certain clinical tests which are very important. You have to learn them. Clinical test. There are 4 types of clinical tests. I will teach you all 4. The most important among them are the tuning fork test. All these tuning fork tests. The second type are audiometric test. Okay, these all are audiometry. What is audiometry? What is the instrument? How it is performed? I will teach you everything. These are also of 4 types. 4 types of clinical test, 4 types of audiometric test, and there are certain special tests. Okay, among them 4, 5 are important. I will teach you special test also. They will tell us the exact location of the lesion with the help of the special test. So can I start? So let's start with the clinical test. Okay, let's see how many we can do today, but definitely we will complete. Okay, all of them. If not today, maybe tomorrow, but we will complete. So most important among them is clinical test. Quickly, I will go a little bit fast. So let's start with the clinical test. How many clinical tests are there? There are 4 clinical tests. What are the 4 clinical tests? Finger friction test, watch test, speech test, and tuning fork test. First, you learn the 4 names. Okay, I'm teaching you clinical test. There are 4 types of clinical test. Tuning fork tests are further of 6 types. Tuning fork tests are further of 6 types. You can see the 6 types over here. Rinne test, very important from exam point of view, for MCQ point of view. Weber test, ultra important. Okay, absolute bone conduction, Schwabach test, bench test, and Gillies test. So these are the 6 tests I will teach you. Very important. All tuning fork, make 5-star over them. They all are very important. Can I start one by one? Let's start. These 3 are not very important, the first 3. So quickly we will finish them. Okay, they are not usually asked in the exam. Usually in your exam, these tests are asked. The tuning fork tests are asked. So let's come on the first one. The first one is finger friction test. Finger friction test. Very easy. Obsolete nowadays, nobody performs. But for historical purpose, you see. Finger friction test. Let's start the first. What I'm teaching you people, what we have learned till now. This is the 3rd chapter I'm teaching you today. First chapter today, I taught you anatomy of ear. Okay, then I taught you physiology of ear, the big flow chart, how the waves transmitted. Yes, anatomy is done, physiology is done. Then I started my 3rd chapter, hearing loss, in which I taught you the classification of the hearing loss. Okay, the conductive, sensory, neural, and mixed, their definitions and their sites. Then I told you the goals of doing the assessment of hearing loss. And then finally we came on the various tests. These all are the tests we perform for assessing hearing loss. The three type of test. Clinical test, very easy to perform, but tuning fork tests are ultra important. There are four type of clinical. So we started with clinical only. Apart from that, we have audiometric test and special test. So clinical test में finger friction test. Now you please, I will perform in front of you. Okay. So kindly be attentive. Let's start with the first finger friction test. What we will do? Examiner rubs or snaps the thumb and finger close to the patient ear like this. This is a patient. Okay. My patient is complaining of deafness. Maybe partial, maybe complete. Okay. So simply I'm rubbing. Can you see? I'm close to the mic. I'm rubbing my thumb and fingers close to each other so I can hear my sound. You please also try. Thumb and finger. Take your thumb, take your finger and just rub them close to your ear. Can you hear a sound? The rubbing sound, the friction sound, the rubbing and friction sound. And I ask the patient whether you can hear it or not. There is no particular distance. It should be close to the ear. There is no particular centimeter I should say. It is close to the ear. So the same thing is written. So this is the examiner hand. This is the patient. So put the examiner hand close to the patient ear and ask the examiner to rub the finger and the thumb close to the patient ear. Okay, examiner rubs thumb and finger close to the patient ear and check the ability to perceive the sound. And we ask the patient whether you can hear it, yes or no. Okay, but there is no standardization. What should be this distance? And the friction can be different of different examiner. There is no standardization. This is rough, but a quick screening test. You can say it is not a definitive test, but it is a screening test. The finger friction test. I hope we are done with the first one. Nobody is going to ask you this one, but you should know. For the sake of completion, I will start with this. I will end with this. I will teach you each and every test, whether it's minor or major. Coming on the second test. Watch test. I don't have it, but watch test. Okay, watch test. So what we are doing, again obsoleted nowadays, nobody performs, but for historical purpose you should know. Watch keep on clicking. Watch keep on clicking. So put the clicking watch near the ear of the patient and ask the patient whether you can hear the clicking sound. Click, 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 click. Okay, put it very close. Okay, put it far apart first. Okay, patient say, no, I can't hear. Then slowly bring it closer, 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 closer. The moment at which the patient say, yes, I can hear the sound, notice that distance. Notice that distance, and based on which we see the severity of the deafness. Got it? Suppose I'm having a watch over here. You can see this is my watch. Okay, it is clicking. So first I will put it here. I can't hear anything. It's not. No. Here, still not here. I guess something here. Yeah, I can hear click, 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 click. So this distance should be noted. Like this we can perform. Okay. So here I can't hear. I can't. But different watch have different clicking sound. The intensity can be different like that. So there is no standardization again. Again, a rough test, but a quick test. I hope you got it. So distance at which the sound is heard is measured. Formerly, it was a popular screening test, but nowadays it's obsolete because we have better ways to do so. We will do it with tuning fork nowadays. So it's not used. And nowadays, who uses clicking watch? Everybody uses smartwatch. Okay. I also searched where is my clicking watch. Long ago, I used that. Okay, for showing you just this experiment. Okay, so again, it's an obsolete test. Nobody does. So this is the second test we have done. We have done the first test. We have done the second test. Can I come on the third test? Say people, say. Say people, can I come on the third test? Let's come on the third test. The third test is speech test. We are done with finger friction. We are done with watch. Okay, the third is speech test. Basic rule. I'm talking, you are hearing. What is the minimum distance between the person who is talking and the person who is listening so that person can hear it clearly? If I'm doing normal conversation, I'm not shouting. I'm doing normal conversation. For normal conversation, the distance should be 12 meter. 12 meter. At 12 meter, if two persons are sitting, suppose me and you, we are sitting at 12. So this is my chair. This is your chair. I'm sitting here. You are sitting there. And if the distance between us is 12 meter, so without shouting, we can talk with each other. We can hear with each other at 12 meter. But if I'm whispering, hello, can you hear me? Whisper, whisper. So whispering के लिए distance should be 6 meter. So for this test, for performing this test, whether we should take 12 meter or 6 meter, so we decided to take 6 meter as a distance, the whisper distance. So we take 6 meter for normal talking. Normally for normal conversation is 12 meter, but for the sake of performing this test, we are taking 6 meter as standard. So what is the procedure? Procedure is very simple. This is my patient. Okay. This is the examiner. This distance should be 6 meter. Okay. This distance should be 6 meter. Okay. We will cover the eyes to stop the lip reading. You know, some person do lip reading. If you can't hear, you will become expert in lip reading. With the lip reading, you can predict what I am saying, like that. To stop that lip reading, we are covering the eyes. So see the procedure. Conduct in a quiet environment. First of all, there should be no surrounding traffic sound or any sound. It should be a quiet environment. Okay. Patients stand with test ear towards the examiner. The test ear is towards the examiner. So this is the examiner. This is the test ear. Eyes shielded to prevent the lip reading. Okay. Eyes are shielded to prevent the lip reading. Okay. After that, non-test ear should be blocked by the tragus. You know, non-test ear should be blocked so that there is better hearing. So suppose this is my defective ear in which there is an examiner who want to perform the test. So first I will block this ear with my own hand. So this is my tragus, you know, small curvature over here, concavity. So you can block like this with your own tragus. This is the tragus. So with the tragus we will block it here. With the tragus we will block it here, and I will cover my eyes also, and at a 6 meter the examiner will say the words. Okay. Now examiner uses spondy words. You know what are spondy words? The two words together, like black night, football, daydream. Okay, butterfly. Okay, my kid knows many spondy words nowadays. He learned what are spondy words in the school, and nowadays he is telling me. So these words are known as spondy words. Black night, football, daydream, like that. Okay, so talk spondy words at a distance of 6 meter. Okay, or some alphanumerical combinations, like any alphanumerical combination, x3b 2az, like that. Okay, and examiner, gradually you start talking like this. Okay, and ask the patient whether you can repeat it. See whether the patient is repeating it correctly or not. Otherwise, move close. Then again start talking the spondy words. If the patient still can't hear, move further close. And mind the distance at which the patient is repeating the words clearly and correctly. Okay, so examiner gradually approach the patient unless and until the sound is heard. Okay, so distance at which the normal conversational as well as whisper sound both are heard, it should be recorded. And that will decide whether the person is having mild or moderate or severe or profound or total hearing loss. Say or not. Say you got it or didn't got it. So procedure, you don't have to learn patient. Look at the picture and say in your own words. So there is a patient. Okay. Ask the patient to sit at a distance of 6 meters from the examiner. The testing ear should be towards the examiner. The non-test ear should be blocked by the patient itself, himself or herself, by blocking the tragus. Okay. Eyes should be shielded to prevent the lip reading. Now start talking spondy words or alphanumerical combination. If the patient can hear, it's good. If can't hear, come closer, come closer, come closer. And notice the distance at which the patient can hear. And that is the final conclusion. Everyone got it? Say. Everyone got it? So this is the test. It is known as speech test. I guess everyone got it? Okay, this is how we perform the speech test. What is the disadvantage? There is lack of standardization. Examiner can have different intensity, no? Someone is having very high pitch sound, someone is having low pitch sound. So intensity and pitch of the examiner differ from examiner to examiner. And so results can differ. There is no one examiner who is performing test on all the patient. So there is no standardization. Again, this is the disadvantage. We are done with these 3 tests. Anyone have any doubt? Otherwise, everyone give me a thumbs up so that I can proceed on the tuning fork test. So we are done with finger friction test. We are done with watch test. We are done with speech test. Everyone got it? Everyone got it? With the model, we can perform these 3 tests. So it will be like this. So suppose this is my patient's ear. Patient is complaining of deafness, whether partial or complete, but patient is complaining some sort of deafness. Okay, this is my patient's ear and I am the examiner. So first test I will perform is finger friction. This is my finger, this is my thumb, I am rubbing with each other, I can hear the sound. Whether my patient can hear the sound, there is no particular distance. I will keep it close to the ear. The only thing, I will keep it close to the ear and ask the patient whether you can hear it. Patient, hello, can you hear it? Yes or no. So that's the only thing, but it's obsoleted nowadays. It's a screening test, quick test, rough test. There is no standardization. The first test, finger friction test. The second test we are performing here is watch test. So I'm having a clicking watch. Where is my watch? Here is my watch. So here is my clicking watch. I will keep it at a distance and ask the patient whether you can hear it. Patient is saying no. So I'm decreasing the distance, decreasing the distance, decreasing the distance, asking the patient, the moment you start hearing, tell me. Patient is saying, yes, yes, I can hear the clicking. Click, 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 I can hear. So I will notice this distance. The distance of the Pinna, EAC starting till this distance. I will notice this distance. Based on which, again, obsolete test, historical importance test, based on which I can tell the patient is having mild, moderate, or severe or profound deafness. The second test. The third test is good one, speech test. Okay. So this is my patient's ear. Okay. The eyes of the patient are shielded to prevent the lip reading. The other ear is blocked by own hand. Now I will stand at a distance of 6 meters. So this distance is 6 meters. Okay. Now I will start talking the spondy words. Daydream, butterfly, football. Not shouting. Normal, we do the conversation with the same intensity I will talk. Okay. And I will whisper also. Daydream, football. Like that. So I will ask the patient whether you heard both or not. If the patient say yes, very good, the distance is 6 meters, the patient is normal. But if the distance is, patient is not hearing, I will decrease the distance, decrease the distance, decrease the distance. And I will notice the minimum distance at which the patient start hearing both conversation as well as whisper. Okay, so this is the complete story of the 3 tests till now I told you. So let's come back. Yes. So let's come back. Let's move it back. And we will go on the next test. The next test is tuning fork test. Okay, ultra important. Let's start tuning fork test. Now, this is what you have to really understand. These were kiddish, very childish and small, very, non-conceptual test. But here you have to understand them. Let's start the tuning fork test. There are 6 tuning fork tests. One by one, we will take them. Let's start with the first one. Achha, before I start tuning fork test, all 6 I will teach you. Let me tell you some basic things regarding the tuning fork. Have you seen a tuning fork? This is a tuning fork. I'm having some with me. You can see this is a tuning fork. Can you see the tuning fork? This is a tuning fork. So see the structure of the tuning fork. These are known as prongs. This is known as stem. And this is known as foot piece. Appreciate in mind. Can you see the prongs? These are the prongs of the tuning fork. This is stem and this is the foot piece. Appreciate the foot piece. Can you appreciate this circle? It's a foot piece. So this is a tuning fork. You can appreciate the tuning fork. Okay. Now tuning fork comes of various frequency, which is measured in hertz. Okay. Of various frequency, depending on their length and distance between the prong, the frequency differ. Okay. So 128, 256, 512, 1024, 2048 and 4096. They are double of each other. So minimum is 128. You multiply 2, multiply 2, multiply 2, multiply 2 likewise. So all these tuning forks are available. I'm having 2 with me. Not all of them. I guess I'm having the 1024 with me. This one 1024 and this one is 128. This one is 128. So the longer one is the smaller frequency. So this one is 128 and as you go smaller, I'm having 1024. So I'm having these 2 with me. You can see the difference in their length also if you wish. This one is a longer one. You can appreciate it. And this one is a shorter. You can appreciate the longer and the shorter. Appreciate it. You want to see on a black background for better visibility? Appreciate the longer and the shorter. Okay. Have you appreciated the 2? So this is 1024. This is 128. The remaining I'm not having, but they all are available. But most commonly, which one we use for our clinical test? Which one we use? We use 512. We use this one. Again, an MCQ. Please learn. We use 512 hertz frequency. I'm not having that one, but we use this one. Why? Why not the lower frequency than that? Why not the higher? Again, 2 MCQs. If we use lower than 512, we use 512. This one is 512. Okay. If we use lower, so bone sensation is more. Bone sensation is more. Okay. And if you use higher, it is having shorter decay. So once we vibrate it, we activate it, it's having very short decay. So best to use the middle one. The middle one is 512. It's an MCQ. Why not shorter? Why not longer? You should know the reason for both of them. So we use 512. This frequency, for routine clinical test, all the tests. I will teach you all these 6 tests now. In all these 6 tests, we will use 512 hertz. Not less than that, not more than that. You should know the reason for both of them. Okay, so this is 512. 512 hertz tuning fork we use. Okay, now how to activate a tuning fork? Suppose this is 512, although it is 1024, but suppose it is one size less, 512. Suppose how to activate that? Activation is very simple. I guess you all may have seen it in your clinical postings. Now, some of you may be having it. So hold it like this, and on a hard surface, maybe your palm, maybe your elbow, or maybe the sole of your shoes, you just hit it like this, strike it like this, and I can feel the vibration. I cannot give you this feel, okay, but it is vibrating like this. It's vibrating. I can have the vibrations. I can feel the vibration. This is known as activation. So this is how we activate it. So how we are activating it, say? So how we are activating it, say? So strike gently against examiner elbow, palm, or any hard surface like this. So it get activated. Now, before I start the test, what we will do in the test? You should know the basics. What you should know? We will test air conduction known as AC. We will test bone conduction known as BC. What is AC? What is BC? What is air conduction? What is bone conduction? You must understand this first. Then I will start the test. Okay. Now take the tuning fork. This is air conduction. This is bone conduction. Let me perform in front of you. So take the tuning fork. Take the tuning fork. One we will see. Okay. So take the tuning fork. First we will perform the air conduction. For performing air conduction, what we are doing? Vibrate. First activate it. Vibrate it on your palm and keep it at 2 centimeters from external auditory canal. So this is the person's external auditory canal. You can see, okay? You can see the person's external auditory canal. This is external auditory canal. So keep the tuning fork at 2 centimeters. This is 2 centimeters. Okay, the vibrating tuning fork. Okay, and see, the person will hear the vibrations. Person will hear the vibrations. The vibrations, the sound vibrations will go from here, and you know the complete pathway. You know it. Can we revise it? Pinna, EAC, tympanic membrane, then ossicles, MIS. From Stapes ka foot plate, it will go to the inner ear. Scala vestibuli, scala tympani, basilar membrane, organ of corti, hair cell. Yaad aaya? From the hair cell, it will go to E. colima and finally reach in the brain. E. colima ka A, auditory area in the brain. So this complete thing is happening and the person can hear the vibrations. Okay, person can hear the vibration. So basically it is testing conductive pathway as well as cochlear pathway. Yes or no? So here, okay, I will do it. First I will do it in front of you. Okay, see how to perform this. Okay, so this is a tuning fork. It is 512 hertz frequency. First I am activating it. So this is my palm. I am striking it against my palm or any hard surface. I am striking and keeping it at 2 centimeters of the testing ear. My testing ear can be this, can be this. So I can test both of my ear one by one. So firstly, what I am doing? I am activating it. I wish I can give it to you and you can also hear. And keeping it at 2 centimeters. I can hear the vibrations very well. Let's do in this ear. So I can hear the vibrations also here very well. Okay, so thankfully my both ears are good. Okay, I'm not having deafness. And it is testing what? So the sound waves are going, and you know the complete flowchart of physiology I taught you in the beginning. From Pinna, it starts with Pinna. You know the complete inside. And you know the A, E. colima ka A, the auditory area 41 in the brain. So complete pathway, it is reaching, and that's why I am hearing. Let's do it again. So yes, the complete pathway E. colima is reaching till here, I can hear. Here also the complete pathway, it is reaching till here. So it is testing my conductive system as well as cochlear system in both the ears. So this is air conduction. Via air it is going now. That's why air conduction. See, so here 2 centimeter distance. So this 2 centimeter contain air. So via air it is going to my ear. Via air it is going to my ear. That's why it is known as air conduction. I hope you got it, people. See, you got it. So sound waves over here. Okay, sound waves over here. They are going in Pinna, then external auditory canal, then going to the tympanic membrane, then it is going to MIS. Via S, it is going to cochlea. You know, complete cochlea means scala vestibuli, scala tympani, helicotrema, basilar membrane, and organ of corti. Via organ of corti, it is going to the eighth nerve, and from here start E. colima, and finally reaching to A, E. colima ka A. So this complete thing is happening here. Okay, it is testing conductive pathway as well as cochlear pathway, the air conduction. You can see this one, don't see that one. See this one, that is bone conduction. I will teach you the next, this one. So I am putting the tuning fork at 2 centimeter distance from the external auditory canal. So sound waves are going here, 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 and complete ecolema also. This is ecolema. So it is testing conductive and cochlear, both. This is conductive. From here till here, it's conductive. This is conductive pathway. I told you the pathway, no? Physiology. And this is cochlear pathway, neural pathway, cochlear pathway, ecolema. So it is testing both. It is testing both. Okay, now let's come on the second one. The bone conduction. This was AC, this is BC. AC test conductive pathway plus cochlear pathway. Okay, you can see how it is transmitting. Coming on BC. How to perform BC? How to perform BC? Vibrate the, I will do it. Vibrate the tuning fork and keep it. You can keep it at the mastoid directly, the behind the pinna. Okay, the stem of the tuning fork. So I will perform it. Okay, you can see I'm performing in front of you. Let me zoom it out. So how I will perform it? People, you can see. So what I'm doing, this is the tuning fork. Can you see the tuning fork? Say yes. So I'm first activating it. So this is how I activated it immediately. This is how I will keep it with a stem. I will hold it with the stem. So first I will activate it and immediately I will put on my mastoid. I can feel the vibration on my skull. Yes, I can feel it. Here also again I'm doing. I can feel. So I'm activating the tuning fork and keeping the stem of the tuning fork on my mastoid. I'm activating it, keeping the stem on my mastoid. I can hear. I'm activating, keeping the stem on my mastoid. Okay, so what is happening? What is this? What is this structure where I'm keeping the stem? What is the structure? It is mastoid. What is behind the mastoid? It's directly cochlear. So it is directly activating the cochlea without going here. You are getting my point? What we have done? It's directly activating the cochlea. People, you got it? So what we are doing? So got it? What we have done in bone conduction? So we have done the, I have activated the tuning fork and the stem of the tuning fork. Okay, the foot plate of the tuning fork, the foot plate of the vibrating tuning fork activated is placed on the mastoid. Okay, so it is directly activating the cochlea. See, it is directly activating the structure. So this complete is bypassed. We are activating it directly and checking ecolema. We are starting with E and checking ecolema. So this one is testing only cochlear function. Now see both of them. See, so this one is air conduction. We are activating the tuning fork. You can see this is the tuning fork I have activated and kept at 2 centimeter in front of pinna. Okay, so via air it's going. So first it is going the conductive pathway and then it is going the cochlear pathway. You can see. First it is going the conductive pathway and then cochlear pathway. But if I'm activating the tuning fork and keeping a vibrating tuning fork directly on the mastoid, so it is directly acting ecolema. So it is bypassing this. What is the summary, people? What's the summary? So this is the tuning fork. I'm activating, keeping it here. It is testing conductive and cochlear both. And I'm activating the tuning fork and keeping it here. It is testing only cochlear. It is testing because it is directly activating the cochlear. So this one is testing conductive and cochlear both. And this one is activating only cochlear. Say people, say the summary. This is known as AC and this is known as BC. Say the summary. Yes or no? AC test conductive and cochlear both. BC test only cochlear. Okay. It tests only cochlear, not the conductive. Conductive deafness. There are two types of deafness, no? Conductive and cochlear. Cochlear is a type of sensory neuron. So we will come to know patient is having which type of deafness, like that. Got it? So in AC, the sound waves first go here, 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 then reach here, then ecolema. But in BC, sound waves directly go here and ecolema. So BC is bypassing this complete system. So you're telling me common sense, which should be longer? AC should be longer or BC should be longer for long duration? Common sense, common sense. Who is having common sense? Huh? Say, ma'am, obviously AC, because AC is having a big pathway. No? It will be longer duration and it will be intense, louder heard. Okay, so it is going from here, 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 then activating this, then ecolema. But BC is shorter because it is directly activating the ecolema, eighth nerve and ecolema. It is bypassing. So normally AC greater than BC, nothing to learn. Nothing to learn. People say yes, we got it. So normally AC greater than BC. Okay, so what is the summary? What I told you here, AC is checking the function of conductive pathway and cochlear, both. But BC is checking only cochlear because it directly stimulates the cochlea. When I do AC, it is going conductive than cochlear. But when I do BC, it directly activates the cochlea. It directly activates the cochlea and tests only cochlea. So AC is longer than BC. Normally, please learn. AC is longer than BC. This is the summary, people. If you understand this, then only you will be able to understand the test, whatever I am going to teach you today. AC is louder and long lasting, both intensity wise as well as duration wise. Intensity wise also this is louder, and duration wise it is longer. Say again, intensity wise it is louder and duration wise it is longer. AC more than BC. I hope everyone got it. AC more than BC. Intensity maybe, duration maybe. You got the reason? Yes or no? In AC, we test conductive and cochlear. But in BC, we directly test cochlear without testing conductive. Everyone say yes. Got it? Say yes, say no, but say something. People respond. You can see AC and BC here. You can see AC, see the pathway. First it is going to conductive pathway and then going equally. Okay, but see the BC, it is directly stimulating the cochlea. Appreciate this line. It is directly stimulating cochlea and directly going to equally. The same thing is given. Now, if you understood this, people give me thumbs up. Come on, few people are responding. You got it or you didn't got it? You want me to take these tests? If you have understood the principle, then only I can start with the first test. I will start with the first test, Rinne's test, if you have understood this. Can I start the Rinne's test? Let's start the first test, Rinne's test. So what we are doing, now all the tests, for all these 6 tests, people learn one thing. You have to say the answer in 4. If you are university, if you are going to prepare for university exam, 4 things. Answer me 4 things. Principle, procedure, okay, interpretation and diagram. For all these tests. First tell me the principle. Then tell me the procedure, step, procedure, method, whatever you say. Then tell me the interpretation along with the diagram. Okay, if you are doing so, you are going to get full marks. And how many MCQs you can't even imagine. You check by yourself, you get on these tests. Can I start? Let's start with the first one, Rinne's test. Rinne test, whatever you pronounce. Okay, pronunciation doesn't matter. So Rinne test. Okay, let's start it. What is the principle? First I will tell you principle, then procedure, interpretation with the diagram. Okay, 4 things. So first principle. So we are taking the examiner here. Suppose I am the patient. Not examiner, patient here. I am patient. I am feeling deafness in this ear. So this is my defective ear, testing ear, and this is my healthy ear. Okay. Or else I can have deafness in both of them. So I will test in both of them. Suppose I am having problem in one of the ear. Suppose my right ear. On my right ear, I am having the problem. Okay. So I will take a tuning fork. Which frequency? 512. I mean, you are the examiner, you are doctor. You will take a tuning fork. I am your patient. I am coming to you. You are ENT specialist. Doctor, I am having some sort of deafness in my this ear. We say, no worries, madam. We will perform Rinne's test. We will come to know whether you have conductive deafness or sensory neural deafness. Okay. How to perform that, doctor? So we will take a tuning fork of 512 hertz frequency. Okay. So this is the tuning fork of 512 hertz frequency in my hand. Okay. And what we will do? We will compare AC and BC of the defective ear with each other. The same ear. This year, I will do AC in this year, I will do BC in this year, and I will compare them. So please, AC and BC of the same year, mark the word same year. You can see same year of the patient. We are doing BC, we are doing AC. Normally is what? Normally is what? Don't forget the normal, people. Don't forget the normal. Normally AC greater than BC. Normally AC greater than BC. How? I have already explained you. Okay, air conduction is more than bone conduction. Yes or no? So first here we perform BC and after that we perform AC, and let's see their length. Let's see their length. Okay. So in Rinne's test, what we are doing, see. So first of all, take the tuning fork. Okay. Activate it. Immediately after activation, put it on BC. Put it on mastoid. Okay. If you feel the vibration, now I stopped it. After stopping, keep it in front of you. Okay, so if AC is greater than BC and I'm healthy, I don't have any deafness, suppose. So after stopping vibrations over here, let's wait, it stopped. Now I should hear it. but it should continue because AC is longer than BC. This is normal. So first you take the tuning fork, okay, keep it on, activate it, keep it on the mastoid. Wait for the vibration to end. Once vibration end here, immediately put it in front of here. This should continue. So it indicates AC is longer than BC. If AC is longer than BC, it occurs in two conditions. AC longer than BC occurs in two conditions. Which two conditions? AC longer than BC. You tell me the interpretation. You got it? What we are doing? Huh? You got it or didn't got it? If AC greater than BC, it is normal and in sensorineural deafness. In sensorineural deafness also AC will greater than BC, no? Because in sensorineural BC is non-functional. AC is functional. Okay, what is sensorineural deafness? In sensorineural deafness, this portion is defective. You got it? So AC will be greater than BC. So normal, if AC is greater than BC, it can be normal, it can be sensorineural. But if BC is greater than AC, suppose I'm activating it, okay, keeping it here. I can feel, still wait, I can feel, now no feel. I'm putting it here. Okay, suppose I'm hearing no sound. So my BC is greater than my AC, but it is not normal. No? Normally AC is greater than BC, but here if BC is greater than AC, it is conductive deafness. So there is some sort of problem in the conductive pathway. You are getting or not getting? I'm trying. Huh? So see how we perform Rinne's test. See. I'm teaching you Rinne's test. Okay. So I am the patient. Okay. This is my ear and I am only examiner. Listen. So this is the tuning fork of 512 Hertz frequency. I am taking it. This is my defective ear. Okay. I want to know this is having some sort of deafness. I want to know in this ear whether it is conductive deafness or sensory neural deafness. I want to know that. But deafness is definitely there because I can feel clinically. Okay, I can feel normal. I can hear normal sound in this ear, but I can hear less sound in this ear. So I'm having some sort of deafness, maybe partial. But which one? Is it conductive or sensory neural? So this is the Rinne's test we are performing. So take a tuning fork of 5.2 Hertz frequency. Okay. Hold it from here, hold it from the stem. Okay, normally what happens? Normally AC is greater than BC. Because in AC, we are testing conductive pathway and cochlear both. But in BC, we are directly activating cochlear. I have explained you well. Normally AC greater than BC. Okay, so what we will do, here we will take the tuning fork of 5.2 Hertz frequency. We will activate it and test BC. BC is shorter na normally. And I'm here feeling the vibrations. Once the vibration stop feeling, I will immediately keep it here for AC. Still I can hear the AC. Okay, so normally AC is longer than BC and here also AC is longer than BC. So maybe I am normal or maybe it's sensory neural deafness. In sensory neural deafness, my cochlea is defective, but my conductive pathway is normal. No? So AC will be greater than BC. But suppose the result is like this. I'm activating it, I'm keeping it here, I can feel the vibration, I'm waiting for the vibration to end. My vibrations have ended. Now I'm keeping it here. But I was supposed to hear AC, but I am not hearing. So my BC is greater than AC. It is negative Rinne. You're getting it? And it is seen in sensory neural deafness. In sensory neural deafness, in conductive deafness, BC is greater than AC. Because in conductive deafness, this one is normal. Cochlea is normal, but there is some problem in conduction. So that's why BC is greater than AC. But normally AC is greater than BC. Everyone give me a thumbs up if you got it. Anyone having any doubt? Please do ask. If you have any doubt, please do ask. So this is how we perform. This is how we perform it. I hope everyone got it. Okay. So see the principle. What I have done, I have compared the AC and BC of the same ear with each other. What I have done? AC and BC. First I perform BC. Once the vibration stop, I will keep it for AC. So I will activate the tuning fork. Keep it for BC. I will wait for the vibration to end. Once the vibration ended, I immediately keep on for AC. Normally, AC is longer than BC. Normally, it should be heard. Here, it is not hearding. So immediately I shifted here, but it should be continued over here. Okay. So normally, what I am doing here, I am comparing the BC and AC of the same ear of the patient. Okay. That is the principle. Procedure may, we are activating it. First, keeping it on the mastoid. Waiting it to stop. Once it stops, we are keeping it for AC. So first we check BC, waiting for the stop, and then we check AC. Still if we can hear AC, so AC is greater than BC. Okay, and if we are not hearing it, so BC is greater than AC. Okay, now this is the interpretation. If AC is greater than BC, it is known as Rinne positive. Normally also it happens, and in sensory neural deafness it happens. But if BC is greater than AC, it is Rinne negative. No, it's not normal. It is seen in conductive hearing loss. And minimum hearing loss should be of 15 to 20 decibel. Then only it is detectable by this test. So this is the minimum hearing loss the person is having. This test can detect. Below this hearing loss, suppose I am having hearing loss of 5 decibel, 7 decibel, 10 decibel, it is not detected by Rinne. It will not be detected by Rinne. For detecting with Rinne, the minimum hearing loss with 5.2 hertz frequency is this. Anyone have any doubt, people? Can I proceed? Everyone got it? So this is the interpretation. You can see this is BC, this is AC. You can see here we are directly activating the mastoid, and here we are keeping in front of AAC. So you see the two arrows, the two red arrows. Which one is darker? AC or BC? Which one is thicker? So here AC is thicker, BC is thinner. You can see this one is thick arrow. I mean AC is longer and BC is smaller. This is positive Rinne. It is seen in sensory neural deafness. Okay, and normally also. And this one is negative Rinne. Here BC is greater than AC. BC is greater than AC. It is seen in conductive deafness. So this is sensory neural deafness. This is conductive deafness. Okay. This is sensory neural deafness as well as normal. And this is conductive deafness. Okay. Based on the Rinne, we can't differentiate is it sensory neural or normal. Is it sensory neural or normal? But if the patient is complaining of deafness, it's not normal. Obviously, it's sensory neural. How many of you got it? So this is the interpretation. Everyone got it? The same thing is shown over here. You can see here. Here you can see AC greater than BC. And here you can see BC greater than AC. Okay, you want to draw this diagram in your exam or this diagram, the meaning is same. I hope you got it. I hope you got it. Yes or no? Okay, so this is how we perform Rinne's test. Okay, so what is the summary? What is the summary of the Rinne's test? What we are doing? So this is, you can see, suppose this is me, patient. Okay, and this ear, you can see this ear. Okay, is defective. So what we are doing? We are taking the tuning fork. Activating it, you see, activating it, keeping it here first for the BC. If the vibrations stop, I will keep it here for AC. Okay, now I can hear it still, so my AC is greater than BC. If I can't hear it, so my BC was greater than AC. So these are the two conditions. AC greater than BC, Rinne positive, BC greater than AC, Rinne negative. Rinne positive and Rinne negative, and you know the interpretation when AC is greater than BC and when AC is greater than AC, in which hearing loss. Everyone got it? This is the summary. So we are done with Rinne's test. Okay, the second test is the Weber test. Very interesting. Here we will keep the tuning fork at the center of the vertex and we will compare the vibration at both the ends like this. I will take the tuning fork, activate it and keep it at my vertex. And I will compare BC of both ears. What I was doing in Rinne, I was comparing BC and AC of the same ear. But what I'm doing in Weber, I am comparing the BC of both ears. So I'm activating it, keeping it at the center of my head, that is vertex here. So vibrations are going here and activating my mastoid. Vibrations are going here, activating my mastoid, and I am asked that which side vibrations are better. Currently, I am feeling vibration equally both. Okay, so this is how Weber test is performed. But it's detailed, people. I'm tired. I would like to continue tomorrow with the Weber test. This is how it is performed. We will see the lateralization. Is it better ear or worse ear? It is in detail I want to explain. I just do not want to cut short the topic. I want to take in detail. Okay. So I will continue it tomorrow. Rinne, Weber and rest all the tests. I will continue it tomorrow. Okay. So tomorrow at the same time we will meet again. Here I would like to end because I'm really tired. But rest of the test with the same, practically I will perform all the tests in front of you so that you have a better understanding. Wherever models are applicable, I will show you the anatomy or the pathology in the models itself. Okay, so tomorrow we will continue the class. Tomorrow also there is a free live demo class. Okay, ENT itself. Okay, so today ENT we have done assessment of hearing, and tomorrow also we will continue assessment of hearing and hearing loss. The classification I already taught you. So we will continue this tomorrow. But tomorrow also the demo class is there, but it is not on YouTube. It is on Midline by Dr. Priyanka app. It's free. It's completely free, but it's on the app. Okay. The link to download the app is given in the comment box. It's pinned. If you have not yet downloaded the app, please download the app MedLive by Dr. Priyanka. This is the name of the app. You can search it on the Play Store. You please download it. You please install it. And tomorrow you can go in the third Prof demo course. It's a free course. You join that course and tomorrow at 6 p.m. 6 p.m., the same time, you will get a live class. That's absolutely free. That's episode 2 of assessment of hearing. So tomorrow, Friday, I would like to meet all of you. Notes of this session will be put in the comment section after the class. The PPT, whatever I taught you, it will be put and it will be pinned. You can download the notes later on. If you have any further query regarding the third Prof 1.0 course or regarding the demos, please WhatsApp on this number. Kindly don't call. WhatsApp support is available on this number. Note down the number. And thank you so much. I really enjoyed teaching you. And tomorrow we will continue with the ENT assessment of hearing. It's a very important topic. Don't miss. So main topic is tomorrow. Today we have done the foundation. Today we have created the base. You have understood everything. Tomorrow I will directly start with the test. Rinne test we will revise quickly in 5 minutes, and from Weber onwards I will continue with all the tests. It's a big table. All the tests I am going to teach you. These all tests tomorrow. So don't you dare to miss. So I will start with this slide only. I will not teach you anatomy and physiology. Don't scared. So tomorrow I will start directly with this page. Rinne we will revise in 5 minutes, and Weber onwards we will continue first with these tests, then these all tests, audiometry. You can't dare to miss it, and then special test. So tomorrow we are going to pack this topic. So thank you so much. I really enjoyed teaching you, and see you tomorrow. I'm ending the session. Bye bye. Good night.